hold it up on here so you could actually see the presenter view.
Yeah.
And we can go from there. So,
Long day. It's recording now, by the way, so.
all right.
Yeah, it's better for this front light feel for the PowerPoint to be seen.
Yeah, I'm sure. Hey, everybody. Hey, Mike.
Good, how you doing?
How are you? How are you? Good. Hey.
Good, how are you?
Hi, everybody. I don't recognize everybody's face here. Hi, I'm Mershwitz. I'm the Associate Dean. Can we go around and just tell me everybody's name?
Sure, Mike Burns.
Mike Burns.
Carolyn Lucas.
You look familiar. Why do I know you? I don't know why I know you.
I'm Bernie Ferran.
Bernie, I know you. I know you.
Christine Isley.
Christine. I know, we've had email conversations. Back.
Renee Subaya.
Sarah, let's see.
Renee Subaya.
Subaya. Did I get it right? I'll probably get it wrong the next time. Tell me your name.
Kimberly White.
Kim.
Sherry Caputo.
Sarah, I know you.
Susan Willoughby. Nicole T.
Welcome. I'm only gonna take 3 seconds, because John has a lot to cover. Welcome to Widener, for those of you who are new. We're so glad that you could be here today. We got lots of good, important information for you. If anybody is interested in doing any labs for me, we have health assessment and pharmacokinetics lab. Health assessment is what it sounds like. Hello, pharmacokinetics labs really help students with med calculations and helping them appreciate the fact that they can't give a 2,000 milliliter injection and what a 2,000 milliliter injection actually looks like. So I do have some open. Hey,
I
Liz.
think there's a whole slew of us out there waiting.
Really?
Because some thought 203, some thought 205.
Oh, then come in. I'm gonna have to say what I said.
Dr. Schwartz, what hours do you have left for your labs?
That's a good question. I will come back down with the schedule. Do I remember off the top of my head? Absolutely not. Liz Bain, I sent you an email to see if you wanted to do labs for me, and you didn't get it, or you didn't respond to me. So you don't love me.
I do love you. I was looking at the calendar. What time is the Wednesday one? Is that morning or night? You don't put military time.
I don't know. All right, we'll wait till everybody comes in. I'll do my dog and pony show then. Uh-huh. Let's take it time.
There are some things that are
Not
good to work.
Actually, we just talked to Dawn, we figured out. Some people have 12 weeks. I think people may have 11 because she wasn't there Friday. Like has 11.
I said I have orientation, I'll be in it. I'll be there for leadership. Yeah.
Dawn has everything. Yeah, I'm there, so nobody was on the
Dr. Williams said that you were doing the sheets.
Yeah.
How you making
How
out?
have you been? Good, good.
Small world, huh? Yep, inheriting grandchildren.
Get out of here.
You're still at St. Christopher's?
Yeah.
John said I had 203. So they were just sitting out there in the, nobody knew what room.
Thanks.
Good.
Feeling good?
Yep.
Good.
So I have to send, I'll send you another email with what's open.
Okay.
Well,
Fridays when we come here.
no,
I did Fridays last semester.
I think I have some open. You were specifically requested, so.
Send me what you want.
So.
Thursdays I teach at or science college, so Monday, Tuesday, Wednesday.
Oh, that's what I'm told.
Okay. Let me know what you have. Because once I plug in here, then I tell the hospital this is all I can do for you. These are
This is why we like you.
This is priorities.
Well, I got a specific request for you, so that's why I emailed that email. The course coordinator was very happy. They were like, yes.
Hey, well, thank you.
So. You know, when the course coordinators are happy, then I'm happy. It's a whole
Yeah. I like that. I really
It's
like
big.
it. It's a good thing.
Now I'm actually working
done yet?
No,
Are you done school yet?
yes, I'm done this semester.
You are?
Yes.
Get out.
This semester.
Does that mean you're gonna leave me? Are you gonna leave me?
No, I will never leave you.
Okay, I was just checking.
No, I'm always gonna be here.
Okay, you know I have to hunt you down.
What?
I'll find you,
Yes.
wherever you're working.
Yes.
Okay, I just wanted you to know, I just want to be clear.
No, I'm never gonna leave you. I already told John. I emailed him back. Congratulations.
All right, so when you starting the DNP program, or the PhD program?
I don't know yet.
Look, we need women of color to get in the PhD program.
Yes, I am. I'm taking this straight, but let me former semester.
I'm just pointing out to you.
I will.
All right, okay, I'm just, no pressure or anything, but I'll write your letter of recommendation for the doctoral program.
Okay, no problem.
Huh? What?
You sure? No. I'm hanging out there with the heart. All right.
I never did the CCO.
Huh? I'm sure. Yeah, I'll help you with that.
But I've worked.
I just wanted one sheet. I got a whole line of people out there.
You have a whole line of people.
And I tried really hard to get it. There's like 10 people. Yeah. We don't have 2 lines? Well, which one color would be good? Yeah.
Hello, how are you?
What's up, bro?
What are we doing? We're doing The coffee helps today, though.
Thank you. It just made me agitated.
Is that it?
That's what we used to call my daughter, agitated Kate.
Well, good afternoon, everybody. I'm going to introduce myself because I know we're a little bit behind. For those of you who do not know me, my name is Rose Schwartz. I am the Associate Dean here, and many of you I know from teaching MedSurg 1 for it seems like a really long time. So for those of you who are new, welcome. For those of you who are returning, thank you. We really depend upon you to help ensure that our students really know what they need to know. So I know that you're going to meet with the course coordinators. I know that John's going to go over some things with you. But you just need to know how important and how valuable what you do is. It's one of the times where students get an 8-to-1 ratio. So you really bring to life in clinical and in labs exactly what we're talking about in class. So keep that in mind. If you are thinking like, oh, you have some downtime or things are slow, that's the perfect opportunity to look at what students are learning in their syllabi and really begin to go over some of that content. And I know John will go over that in more detail with you. The other piece is that I do have some health assessment and some pharmacokinetics labs open. So if you are interested in doing some labs in addition to clinical, please don't hesitate to contact me. My email address is raschwartz, schwartz, at widener.edu or at mail.widener.edu, either place. You could always look me up on the website. It's kind of nice. That's actually a really good picture of me. I look much better in the picture than I do in person. So you could just say, wow, she really looks pretty cool there. With that said, I'm also going to take a minute to introduce you to our amazing dean, who I am so grateful to work with every single day.
Most days, 4 days out of 5.
4 days out of 5. But
Let's be honest.
she keeps me around, so I guess I kind of am glad she's here. So I'm going to turn it over to Laura. And again, if you ever have any problems or any questions or any worries or any issues, don't hesitate to reach out to me. I am here all the time, it seems, every day. And if I'm not here, trust me, everybody knows how to get me. So.
I'm Laura Zurich in my wrapping up year 2. It's hard to believe of being here. And I would be really interested as we start out, what motivates anyone, especially those of you who've been here a while and seen what's going on. What motivates you to be an adjunct faculty person for us? Anybody?
My daughter graduated from here, and I thought it was such a great program that I wanted to be a part of giving back.
Oh, thanks. It is a great program. It is because we have the best faculty I've ever worked with. And you all are a part of that. So, anybody else? What motivates you to do this? Anything at all?
Teaching.
Isn't it wonderful? I have to say, although I hesitate always to admit this publicly, I am not a clinician. I do clinical work because it makes me a better teacher. I didn't know that when I started out. I thought I really wanted to be a nurse. Well, it turns out I really want to teach nursing and do the research associated. And it is, for me, it's an incredible joy. And do you remember that old Johnson & Johnson commercial about it always makes me cry. I can never quite believe it. How did I touch this life here and this life here and this life here? And then she says, I teach nursing. It's like, oh my God, that's exactly right. You can get to people quickly. I'm always in a hurry. It's a good way to, and really impact what they believe and what they think and how they practice, who they are.
Mm-hmm.
And we turn out a great graduate. We really do.
We do.
Because our faculty are really fine and they hold people's feet to the fire, which is an important part of your role, even when it's hard. And sometimes it's hard. How many of you have taught before? Many of you. Sometimes it's tough. But there it is, and you've got good people to guide you and great clinical sites and lots of opportunities. So that's probably all you need to hear from me, unless somebody wants to tell me anything at all. Any questions? Any issues? Any concerns?
Well,
It's like like the first day in class.
It is.
Yeah, I was just gonna say, not until the beginning of the semester, yeah.
We don't usually bite the faculty, we wait to do that to the students.
Yeah.
So again, if there's anything ever that I can do for you, if you come across an issue or a situation and you wanna talk, if you are interested in expanding teaching from clinical to the classroom, please let me know. That's always a possibility and something that we look for. So if you want to do that and try your hand at classroom teaching, we can surely work with you on that as well. You know, our job is not only to hire you as great clinical instructors, but to grow you as educators. And if anybody's interested who has their master's in the PhD program, come see me, or come see Majama, because I'm getting her in the PhD program. That's my mission now. So if you're interested in learning more about our doctoral programs, if you don't have your MSN, just know you can teach for us for 5 years. Without an MSN, you need to get one. We would truly love for you to get into our MSN program. We have a Master's in Nursing Education and Executive Nurse Leadership in Family Nurse Practitioner and a Clinical Nurse Specialist. And Mojama's finishing the FNP program this year. I'll be cheering for her at graduation. Mojama and I go way back. When I was a baby instructor, Mojama was like an experienced clinical instructor. It was wonderful. She's only 12 though, so. So again, anything, any questions, anything we could do for you, don't hesitate to ask. All right?
It's fun. Thank you all. Thanks for doing this. We really appreciate it. And we appreciate.
Thank you, guys. Thank you so much.
Thanks, John.
Thank you.
Bye,
Oh,
all.
excellent.
Bye.
Okay, see you later. Thanks, ladies. So, my name is John Esposito. Hello. I know a couple different people have been in the role that I am, but I'm currently sitting as the interim clinical director of undergraduate clinical placement. It's so bright. No matter how many times I give talks, it still blinds me. So, thank you for coming today. I greatly appreciate it. I see some new faces. See some faces I may know. See some faces I don't know. I know you guys don't know me either. So, I like to just go around the room real quick, particularly for the fact of our goal for this semester and our upcoming semesters following is the idea of moving forward. The idea of moving forward to the point of a mentoring, coaching, a partnership. A partnership in regards to our clinical faculty pairing with each other, our newer faculty and our senior faculty coming together. I'm really trying to build a solid A team, which is why everyone is sitting in this room today. And I thank you for coming. The interesting piece, especially with our faculty members, is our program is growing. We are really, really growing in some decent numbers, if not astronomical. We have a large cohort that's coming in the fall, okay? They're looking at different programs to start up. There was a conversation about even doing an accelerated program. Still no summer clinicals yet, although that used to be my favorite back in 2010 when I started with us. Now I figured out year-round clinical teaching, can't go wrong here. So, right? Can't go wrong. So, with that being said, we are still for our new nurses, for our new faculty, and for our senior faculty, things really haven't changed so much from the senior faculty perspective. You're still going, my position, they have like remolded my role, so to speak, okay? And the vision for me with this new role is the partnering, the mentoring, the being able to have that collaborative relationship with the faculty, being able to have that public relation piece from the university to our affiliation sites. If there's ever any issues with the affiliation, if we're ever getting any pushback from the site, from the floor, by all means, I am an extremely proactive guy for the individuals that do know me. And I'd rather jump on it ahead of time, partner together, get everything a nice, smooth clinical rotation. Your course coordinators are obviously still gonna be your head honchos in regards to building your curriculum, notifying of any student issues, any dilemmas with a student, anything of that nature. We're really, really, like I said, really trying to push forward with this and get a really good team going on. The program is growing and we're all really, really excited about it, all right? So if we don't mind just taking like 4 minutes, just going around the room, the name, the section you've been hired for to teach, and have you been with the university for a while or is this your first semester? Nicole?
I'm Nicole Teagle. I'm gonna be teaching women's health, labor and delivery at Einstein. This is my first teaching job. Susan Willoughby. Sorry. And I'm going to be at Mercy Fitz with senior leadership. Will be my second semester teaching for Widener. Last semester I did med-surg at Barclay France.
I'm Liz Bain, I'll be doing med-surg. Med-surg 2 at Chester County Hospital. This is my 4th semester. I've done med-surg 1 twice, and I've done head-to-toe assessment lab.
How did you like the labs, going from the clinical group to the labs?
I loved it because I now know what they can do and what they're capable of.
Yes.
They can't fool me.
Yes. Yes.
Don't tell me you didn't learn it, I taught it to you.
Yeah.
My name is Jill Sickler and I'll be teaching leadership.
Hi, Jill.
My name is Mike Burns, and I will be teaching med-surg at the Bryn Mawr Hospital site, and it's my first time teaching.
Hi, my name is Marty Sobolewski, and I'll be teaching population health out in the community, and this is my first time teaching with Widener.
Welcome, welcome.
My name is Keisha Mason DeProspero. This is my 3rd year. I'll be teaching leadership at Crozier.
Okay.
My name is Debbie McDermott. This is my 1st year at Widener. I will be teaching med-surg at Crozier, oncology floor, and the sim lab.
My name is Christine Noffin. I will be teaching leadership at AI DuPont. This is my first teaching job ever.
My name's Lauren Short. I'll be teaching pediatrics at Shriners Hospital for Children, and this is my 2nd semester.
I'm Sherry Caputo. This is my first time teaching. I'll be doing a couple clinical skills labs.
My name is Carolyn Lucas. This is my 2nd semester. I'll be teaching mental health at, I think it's at Einstein this semester.
I'm Erica Nichols. I'm teaching OB at Crozier, and this is my 1st semester ever. I'm Vanessa Williams. I'll also be doing OB at Riddle, and this is my 1st semester.
I gotta ask, do you ever get like VIP seating or anything with your name?
Yeah.
Oh.
You need to play it off. You need to play it off. That's why she's here today. That's why she's here.
Love you on the good way.
Hi, I'm Kim White. I'll be teaching peds at Children's Hospital. This is my first teaching job with Widener.
Renee Subaya, med-surg at Einstein, and this is my first teaching gig. However, I think as nurses, we're always teaching, so this is not our first teaching.
That's right.
But this is my first time teaching with Widener. How's that?
I'm Bernie Ferran. I've been here for 2.5 years teaching in population health.
Hi, I'm Sherry Becker, new to Widener, new to teaching.
Welcome.
I'll be in population health in the schools.
Excellent.
I'm Vanessa Orloff. I'll be doing med-surg at Delaware County Memorial Hospital. This is also my first time.
Hi, I'm Donna Flamenco. I'll be teaching med-surg 2 at Conlon, and this is also my first time.
Guys, my name is Matthew Opham. I'll be doing med-surg 2 at Crozier, and it's my 1st semester as well.
I'm Nick Fisher, I'm the old. We're on year 9. Let's see, leadership at Crozier, med-surg 2 at Lankenau, Farm Lab, and Health Assessment Lab. As of right now.
Right. Whatever Rose says, right? As you
Exactly.
mentioned earlier.
Hi, my name is Katie Flaherty. This is my 3rd semester teaching at Widener. I will have students med-surg 2 at Fitz, and then leadership Tuesday, Thursday at Penn Presby.
Excellent.
Hi, my name is Kim Watson. I've been with Widener for 5 years. I'll be teaching leadership and med-surg 2 at Cooper in Camden, New Jersey.
And hi, my name is Annette Pidemango. This is my 10th semester here at Widener. I'll be teaching a double OB clinical at Delaware County Memorial.
Hi, my name is Manjama Kongo, and I've been here since 2009, teaching for Widener, and I will be at Delaware County Memorial Hospital with med-surg 2 next semester.
I'm Christine Wisely. I'm going to be med-surg at Taylor, and this is my 3rd semester. Susan Osborne. This is my 5th semester. I'm going to do med-surg 2 at Paoli.
Dr. Richardson.
Thompson, second semester. I'll be doing med-surg at Cooper.
Alita Thompson, second semester, I'll be at the Wayne.
Excellent. Well, welcome everybody. Thank you for going around doing that. You can see we kind of have a distinction in regards to our new adjunct bringing on and our senior faculty that have been here. And I really, really urge everyone to kind of partner. I will be coming out to the sites, checking in, making sure our faculty is good, making sure there's any issues with the students, there's any issues with the sites, and also helps too, especially with the faculty out in the field, so to speak, to have administration there. So this way it kind of solidifies our spot. We are guests coming into these institutions, okay, as many of you know. So we do our best, and our main goal is obviously the ideal student rotation, student experience, and being able, sorry Nicole if I keep standing in front of you, and being able to actually deliver the care and the relationship that we can provide. It's extremely hard to get these sites. We fight for these sites, especially the really, really intense sites that we have. This way the students can get that much of a piece. As far as your normal clinical day, senior faculty, excuse me for going through this, but I know I did speak with some of our newer faculty that I hired, but typical clinical day, different things that we're seeing is, or barriers that we may be facing, is the issue of the students having a hard time kind of getting settled. Senior faculty speak to this, particularly in the first start of the semester, okay? For our new faculty coming on, I truly, truly need, and I know I've said this numerous times, but I need everyone to be able to forgive themselves, okay? Forgive yourselves. This is a new role, all right? This is a new development for all of us, and we continue to develop as nurses, as we all know. So we want to be able to get our students situated. The most important and one of the hit-home topics is the orientation that the institutions offer for you, make sure you go. That's a mandatory piece. For individuals that haven't taught before or just haven't taught with Widener before, that's an ideal opportunity to kind of have your public relation hat on and be able to partner with the institution and say, hey, listen, what works best for your unit? What is most successful for your clinical rotation here? I would love to make my rotation revolve around that piece of it. And we can then kind of partner and continue to build that, and also looking at another light to kind of build your clinical day for you, or at least help guide you, particularly for that institution. Students have often said that, you know, we found that there's downtime, which is one of the things that it's extremely hard to combat, particularly as faculty members, as what can we do to kind of get rid of the downtime that's being found on the floor. Institutions, obviously, the pushback and the concern is the fact that they don't want to see downtime. The university doesn't want to see downtime. It's often, sometimes, speaking from my own faculty experience, it can be a very big frustrating that you're running around, you're trying to manage these, you're managing these 8 students, not trying, but you're managing these 8 students, and you're trying to literally give them everything you got, blood, sweat, and tears, right? And you have the student that wants to sit there and read a chart. I see Annette nodding her head up there. While there's actually delivery, I'll put it to you, there's actually delivery going on, but the student wants to sit there and read a chart. No, you need to get up, you need to go, you need to go see this delivery, because, you know, this is what you need to have the experience for. If there's ever any concerns, or if we need any tips or different ways to approach things, please let me know. Please let your course coordinators know, okay? These are really nice ways to have that teachable moment, be able to provide that constructive feedback, and be able to pretty much move them from a coaching perspective into the right realm of view for them to be able to move forward as well. A big piece also to kind of take home with this, and this was something that I just learned, honestly, 3 weeks ago. One of the med-surg instructors and faculty members brought to light that there's an issue with the students not getting it, to the point of connecting our didactic approach to our actual clinical approach, which is what we're here as adjunct faculty for, right? We're here to actually be able to provide that connection. The issue that came about was the fact that the students, and all novices, as we all know, we can quote better until we're blue in the face, but all novices, they want to do that task. They have that task piece. They have that task piece of, I want to give insulin, it's a sub-Q injection, this is how I do it, boom, 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 boom. But they're not connecting the piece of, I need to get a pre and a post sugar. And that was literally what was discussed in a didactic lecture, was the fact that Dr. Francis asked, oh, you gave insulin, so what did you do? What was the sugar pre? What was the sugar post? And the student looked at her in deer in the headlights. An additional follow-up question to her was, well, okay, if you didn't get that, and this was hypoglycemic, what would be the symptoms? And they're just not seeing it, okay? So just kind of bringing that forward to the faculty and letting you know that's kind of how we're seeing things going from one piece to the other. Another interesting topic that was brought forward, and I didn't know this whatsoever, was the fact that NCLEX, raise your hand if you know this, because I didn't, I was out of this loop. NCLEX is only testing on generic. So as clinicians, you knew that? Thanks. Or, see, you could have shot me an email, filled me in. This would have worked out really, really well when I had my meeting with the dean, instead of me going, So with that being said, they're only testing generic. As clinicians, I know myself, it's a whole hell of a lot easier for me to say Tylenol versus acetaminophen. So we teach brand, all right? We need to just take that step back and just be conscious of that and put that forward into our cognition and be able to deliver that from a knowledge base to our students, to the fact that you're gonna be tested on generic. You're gonna be tested on generic, you need to understand generic. Dr. Williams brought up a really, really good method for teaching. She teaches in her class first and last names. So she teaches the drugs as a first and last name. Lamictal, lamatogrel, Tylenol, acetaminophen. And it just helps with that connection. At least if they're then sitting and taking the exams, they have that additional piece. So that's a hint I can provide you. That's something I'm gonna try and incorporate as well. Other piece that we're sometimes seeing, getting out just the housekeeping portion of a clinical day and clinical concerns, is student absenteeism, okay? Please, 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 coordinate that and communicate that to your course coordinator, okay? Once a student is absent, if you have concerns about a student, communicate that to the course coordinator. They need to know. There could be things going on in the background scene that you may not know. I'm not gonna be privy to, because that's a student kind of conversation that would go to Linda O'Kane and the course coordinator, and then I would get looped in, of course, if there was a necessity for me to be aware. But the issue then comes into play of the faculty, you know, making sure, my job is to make sure that you guys are good. You're safe, you're comfortable in your role, you're comfortable at the site, you have any questions, comments, concerns from a student perspective, anything you need, I'm here to support you. If I'm not supporting you, in all honesty, they might as well not pay me. And I'm being recorded for that. So, with that being said, I'm here to support you guys, okay? I'm here to give you any of my experiences. I want to learn from your experiences. Again, you could have emailed me in regards to the generic, okay? But, you know, I'm here to have that collaborative relationship. I'm here to have that collaborative relationship with the institution. I'm here to have that collaborative relationship with you, with your students, and so on. I'm really, really hoping, and my vision for this position moving forward is to be able to develop that. To be able to develop our practice and our faculty staff to the point of, I want senior faculty. I want all the individuals that I hired over the last 6 weeks to stay with me forever. I don't want to lose any of my senior faculty whatsoever. I want to be able to have that. I want to be able to have that corroborated. I want to be able for my course coordinators, for my full-time faculty members to say, hey John, this was a stellar semester. We had no issues. There was an issue at the Kendall site, but I know that's not my faculty related type piece, okay? So that would be our touch base for absenteeism, although it's 55 degrees and Christmas is a week away, okay? And I have been totally digging this hot weather. I feel like I'm in Florida. But snow times. So, rules with the snow, just to kind of clarify this. If the university is closed, clinicals canceled. Now, for us that have day routines, day shifts, you're already going to be at the site technically by that time, right? You're trying to get in like 6:30, that half hour prior. So, what do? I do not want to see anyone get hurt. I want everyone to be safe. My empowerment to my faculty is the piece of being able to provide all that autonomy. This is your clinical rotation, okay? We need to be able to provide the students with what we need to be able to provide them for them to be successful in the real world, so to speak, okay? And although that is literally a generalization of our job profile, it is the idea of, I still want, everybody needs to be safe. So, with that autonomy, my caveat would be, delay your clinical day. If you're concerned for the snow or we're not quite sure, try not to cancel the clinical day, delay the clinical day, delay it to 2 hours. Reassess where it's at. At that point, you'll then have a idea of exactly was the university canceled, was the university not canceled? Okay? If I've had questions brought up to me recently, everyone gets sick, I understand that, okay? The idea though is the clinical makeup time, okay? Clinical time needs to be made up for clinical time. There is no longer any routine with doing a alternative assignment, all right? The students need the clinical time. If they don't have the clinical time and it's not proven technically, we can't then move them forward to take an NCLEX exam, okay? We need the clinical time. So if clinical time is made up, it needs to be made up for clinical time. So what happens if a student misses a class because they're sick or there's an issue, so on and so forth? That's the ideal of communicating with the course coordinators who have so many routines, so many ways of going about it, being able to get this done for the students. Okay? All right. Ladies and gents, different ideas in regards to being able to combat downtime, okay? Ideas to be able to combat downtime. We can do multiple different things. We have our case studies, which everybody says, hey, do a case study. Different ways that I found that was helpful to combat clinical downtime. Students want to know about you. This is why we hire such upper echelon nurses. Our students want to learn about you. What do you do every day? What is your experiences? How do you go about your day? They are going to mimic your best practice, which we all have, all right? So share that. If there's opportunities, Deb, can I use you an example, if you don't mind? So Deb had a opportunity this year at, was it one of the Kendall sites? Was it one of your sites where you did the flu clinic? Long-term care, thank you. So Deb had an opportunity in long-term care to be able to physically put on a flu clinic for this institution. They had their flu shots in, she was able to coordinate, build that networking affiliation type piece, which I really am trying to hit home, you know? And, and she was able to build that to the point of having that flu clinic be able to be a developmental piece so that we could then have the students have a whole heck of another experience. If you think about it, everything that we're building within this course program is going to stack on top of each other. So although she's in Med-Surg 1 providing our basic, literally first level of entry of nursing care, that flu clinic literally taps into the public health vision of trying to provide into the nature, trying to provide into the community, and seeing how we can deliver full range front on. Clinical hours have to be made up for clinical hours, as we mentioned. Our clinical day needs to have that 7-hour piece as well, okay? I understand there's downtime. I understand there can be downtime. Another different idea, like I said, to combat downtime is to be able to kind of put it onto yourself. When I used to teach for us, from an adjunct standpoint, I would work at CHOP on 6 East. So pretty much the nurses told me, well, it was actually all my students. So so we would walk in the morning, they would say, John, here's your assignment. They would literally hand it. I would disseminate it to my students at the time, like we all do, and they would go about their day. Come 11 o'clock, something of that piece, it got quiet, right? And there was no micromanaging me to the nurses. They would have had my head, especially within that population. So we would do different alternatives. I would kind of do, instead of that case study piece, I may pretend once that I was giving a report to the students, giving a report to the SAGs. I was just saying something as simple as, you guys are going to be the accepting nurse, I'm going to be the sending nurse, and I'm going to give you a report, you let me know what you want to do. And something as simple as, Liz, I have a MRCP patient that's going to come your way. You're the ICU nurse. He's going to get admitted up into the ICU. He has a 6-0 trach. He's on pressure control ventilation. He sounds really junky and he has a cough. He's coming up to you right now. And then all the students, I'd say, that's it. And then the students would just give me deer in the headlights, which I really strive for. It's almost like a torturing thing. I try to do it with my children, but they pretty much tell me forget about it. So with that being said, you then have the brave soul that raises their hand and say, what do you mean about this? What do you mean about sounding course? What do you mean? What is a Shiley? You know, and just things like that. You would be surprised that something as simple as those 5 statements would turn into a 2-hour conversation, and you're able to just build one on top of the other. Okay? Again, if there will be, the shared files is something we're really trying to move forward to as well. There'll be different ideas on the shared files. Dr. Schwartz just filled me in in regards to the NCLEX is going to be having another update in 2016, and that piece in that test map should be on shared files as well. Okay? All right. The 7-hour clinical day, like I said, needs to remain 7 hours in order for these students to have 12 days, 84 hours. Yes, they can now sit and take their NCLEX exam. That does not mean if you're bringing them in at 6:30, okay, and you have them leave at 1:30, it's 7 hours, okay? But please stay the duration. I had some circumstances throughout the semester where I had students that were literally, instructors were leaving 3 hours before their end of their shift, and by the end of the semester, I now have 15 to 20 clinical hours that I need to make up. That's a big hiccup. That's a big hiccup, okay? There is a piece, a form that came through. Did anyone see this? This is another piece I learned about after my 5 years of teaching here at Widener. It's the learning prescription. You guys familiar with it? So this learning prescription is something that's been around for my understanding, eons. And the learning prescription, the idea of the learning prescription is, it's technically almost like a red tape, so to speak, okay? Let's say we need to remediate a student, all right? Let's say we need to remediate a student. You brought a student in, Jill had a student that came through, and Jill went through health assessment 42 times, 42 different ways. And the student, unfortunately, still is just not grasping that concept. That's okay, but Jill still has 7 other students that she now needs to kind of move along through clinical. The idea of this learning prescription is she would fill this out, the clinical faculty member would fill this out, and they would run through and go through. The student now has to take this to Dawn Ferry and her team at the simulation department. They then have to go through, remediate the student. It gets signed, it gets put into the student's file, it then gets sent back to Jill saying, this student is competent to be able to do this task. This helps on several different reasons. This helps for our students that just might need to hear a different way of teaching, all right? My teaching style can be, it is, I know, a little unorthodox, but a little bit totally different than other individuals' teaching style. And that's okay, that's why we're all here. That's why we're all here to teach. But they may need to hear it a little bit differently. Nursing just may not be their bag for them. They may need something else, all right? This then provides us with those resources to be able to continue to go through and look forward to exactly what we need to do. Everybody like my ice bucket? My wife sent it out to the house with me today. My wife sent it out. That and the conversation before I left the door, she said, so hun, I don't even know if I got a hun, to be honest with you, but I'll say that because I'm on the recording. So she said, how many people are coming today? Did you do an RSVP? I went, no. I said, I think like 30 or 40. I did good. I kind of got a good idea here. I said, I think 30 or 40. She goes, so did you do an RSVP? I said, no. She goes, how do you know? I'm like, I don't know. So then, of course, I'm leaving with my blue cooler, and she's saying to me, you're not leaving the house with a blue cooler. She gave me the ice bucket. This is like more valuable, I think, than my children at times. So, but I got the ice bucket. So I think I might be getting advanced. I don't know if dinner's going to be ready, but I got the ice bucket. I mentioned briefly in regards to the medications. Another portion of the students' issue, we're kind of moving forward. For those of us that taught pharmacokinetics, right? Not yet? Not yet, okay. So the idea is with that one lab, what's that?
She's trying to get me into it.
She's trying to get there. So pharmacokinetics is interesting. It's for the sophomores, okay? The sophomore is a sophomore level, and it's more or less, I like to think of it as med math, med administration, and it's a lab-focused course, and it be able to give them the groundwork of this is what 10 units looks like, this is what 10 milliliters looks like, and so on and so forth. The issue that's also coming forward, if I use that insulin piece as a example, the students would be doing the math or having a conversation of, I gave 10. The conversation is you gave 10 what of Lantus? I gave 10 milliliters. No, you didn't give 10 milliliters, you just killed the poor individual. You gave 10 units. So the students, it's hard. That was one of my hardest things I remember to grasp as a student was, what does what look like? What does what syringes look like? Remember, some of these students that you're teaching have never seen that before. You know, we're getting juniors. This is some of the junior, not so much in the spring, but in the fall, if you're just finishing up teaching now, this is the first time they may have actually stepped into an institution before. Okay, so they may not have seen this, they may not know. So again, be able to have that point of, again, from a clinical perspective, we have utmost expertise in this room, which is why everybody is in here. Just trying to just remember that too, that these students may have never even seen a blood pressure machine, they may have never even seen a blood pressure cuff, so on and so forth. All right? They also need to understand the pharmacokinetics and the pharmacodynamics in regards to being able to connect what is going on from a clinical aspect to why am I doing this? For the simple reason of this patient has a heart rate of 40, do I really want to go load them up with a double load of labetalol? May not be an ideal option. Or do I need to get a blood pressure before I go giving an antihypertensive? Things like that are different pieces that we just kind of want our faculty to just make sure we're honing in on. Okay? That was one other thing that was noted in a didactic perspective. We're going to be doing something a little differently, and then I'm going to turn this over to Tracy and Tricia just to talk a little bit about the different portions with our tuition remission and our clinical site requirements and so on and so forth. But one other topic just to hit is the fact of we hired an IT professional, Andrew Bobel. Bobel? Did I say that right? Thank you. So he is the head of our IT for the School of Nursing. All right, so he handles all of our monitoring, although I wasn't able to get presenter view, but we were able to handle that piece. So him and I have partnered, and we're starting a little project, particularly with this, hence the recording, that for the faculty that weren't able to make it, so that this way the communication is being disseminated appropriately, links are going to be sent out. He'll talk more about this as well. There's also going to be a piece of links being sent out for different ways to use Campus Cruiser, use our email access, and things of that nature. It helps hone in the faculty to what's actually going on for the academic setting. Okay? All right. Tracy, would you like to speak?
Hi, I'm Tracy Swanson. I'm the Dean's Administrative Assistant. And I'm here to talk to you about tuition remission. If you want to take a sec and pass them around. I think there's enough there for everyone. If you apply for tuition remission, the forms come directly to me. They do not go to HR. They don't go anywhere else. They come directly to me. The instructions are there, and what it is, you have to, for each course and for each clinical you do teach, you earn credits. It depends on which course and how many hours of clinical you're teaching to how many credits you earn each semester. And once you have earned 6 credits, you are then eligible for a 3-credit course for reimbursement. I know it seems a little difficult. I keep track of it all, and like if you're teaching this semester and you don't have enough credits, but you will have enough credits if you teach for us again in the fall, those credits that you earned in a spring semester will transfer over to the fall for you. So if you have any questions, an extension 4213, I'm down in the Dean's Suite. Please feel free to email me, call me, stop by, ask any of the questions you have. I'd be glad to answer it. Does anybody have? Sure.
How long do they roll over, and how long do they last?
It's only for like they say a year, but I'll push it to a year and a half. But if they don't do it, and they don't, the university won't let us hold them too long. And you have to have the full 6 credits for a 3-credit course. They don't do partial. Okay, any other questions?
Do they also include the sim lab, or is it just for the?
No, they also, you get credit for sim lab too.
Okay.
It depends on how many hours of sim, the lab you're doing.
Okay, thank you.
We do include them. Theory courses, clinical, sim, labs, everything. Okay?
Thank you.
Sure. And any questions, just give me a call.
We should be coming around.
Did everyone have the opportunity to sign in? Yeah.
Any of the new instructors have to achieve the G for paperwork?
That was handed to you. Piece of paper was handed to you. Your signatures on
Yeah,
that.
there was two there.
Okay. This isn't bad.
Thank you, Tracy. Thank you, Tricia. Does everybody know Tracy and Tricia? I know Tracy is interested. This is Tricia Grande, all right? She's our,
Trish a lot.
Yeah.
Does anybody have any problems with any of the paperwork they have to take up with Trish?
yes.
Okay?
All right. Thank you, ladies. Thanks so much. Do you guys want a break? Do you want to grab a drink? Run to the restroom, anything like that? Yes, no, maybe so. Yeah, we could take like a 10-minute break, something like that.
No, it's opposite. I started out on day shift, on I transferred over. I could not, the names of each other. I felt so sick. I know. And I did have that. The first thing now was like 27 hours. Then when I came back home, it takes me 12 minutes to get to school. Oh my gosh, it's awesome. Okay, there's and she became our resource all day long. Like, you call her up, it's here for lunch, you know, whatever it was. And that was our resource. And I knew that there's it's just, and I honestly think one of them is doing business, so I don't know. Not this morning. I started out with my friend, I teach stuff. I was like, Bob, and she's coming ahead with like your ends too small, and so this whole thing started. But I think I was really I look at it because the idea of not that I'm concerned, but I'm just saying, like, you know, can you do something, there's just kind of really everything. You're YouTube, there's something that label, but I'm like, right, I love what's going on, what are you thinking? Like, I just connected, I'm like, okay, what? Like, so that's because I would think that's how I make sure I have every semester. It didn't work, I don't know what it what? It looks great. I really tried. Yes, that's why I can't do too. I took this semester. I couldn't send her applicants like a job. I talked to my students this semester because, you know, it would be a good first yes, I know. I put that application in which is great.
could be something.
They're alive, and then we can talk about the new stuff, and it's like, hey, so I did this, and I did really well, I did this. It wasn't taking over very well, so.
And then I tried the OR, it was okay. But it had to just fall. So they still waiting. And it was
I'm working. As soon as I took this, I'm happy. It's great. Yeah, why is it like morning that's all like an hour between, but those are the presentations we also do presentations where they go to each other on the right side and they can just no, it's good Saturday. And you need to text to the and now talking about the presentations so she's more
Run out of these.
You want me to? I can send her, I'll send her an email.
Just kind of like,
Send her an email just so she's aware, yeah.
because it came out, so there's another kind of job out here in 2016.
Yeah,
thing.
yeah.
Something too. And again,
Oh, yeah, oh, they're absolutely on. Yeah. They are trying. Yeah, they're trying. Okay. Yeah.
But that's awesome. Yeah, thank you so much. And this is Bert, by any means, if I misspoke, please correct, okay? So yeah, so she would be called.
Is she taller?
Guys, I'm gonna bring this back in if we All right, colleagues, I'd like to see if we can just start cohorting back together and we'll move on with the day. I know. So let's see if we can just kind of bring ourselves back together now. So I just want to go through and just touch base a couple different pieces. Some additional areas that we've really want to hone in on, particularly for our spring semesters and semesters moving forward, is feedback. Some of the feedback that faculty have been, that we have received from the students is some students haven't been given daily feedback or feedback throughout their clinical rotation at all, unfortunately. We have our evaluation systems that's kind of built forward. We have our midterm eval, we have our final eval. Just to kind of clarify that piece. The midterm eval is a piece of a conversation and an informal evaluation that should be occurring between yourselves and the students during the time and date that you pick throughout the semester, preferably in the middle. The final evaluation, once that's done and it's signed by faculty and student alike, it then comes back and goes into the course coordinator. It needs to come back to the university because that goes into the permanent student file, and that is for different sakes. It's a paper trail, again, it's for pieces if the university was to get audited, and we need that to be able to have forward so that the students can have that as a reference within their file. Feedback is extremely important, particularly at the undergraduate level, because they need to understand what is the right thing and what is not the right thing to be able to do, okay? Not even so much from a clinical aspect, just from a professional aspect. I mean, how many of us, even at our levels, have we had conversations with a colleague and the communication is just so off that you leave it going, did that even just occur? Or did I even get anywhere, you know? Imagine it from the undergraduate perspective. Some of these students don't even know how to have a conversation with a patient. I remember in pediatrics, for example, I would ask my student to go do an assessment on the baby and the family would be there and they would just freeze. They would just freeze. And then I would come in and I would see them doing one of these, preferably not with the jazz hands out, but they would just literally freeze to the point of, I would say, just talk to them like it's a family member. Just make sure you're talking to them in the appropriate manner, you know? Have that professional piece, that professional courtesy, that professional situation. And that's something we really need to hone in, particularly with the generation that we're teaching to, okay? One of the distinctions when we're looking forward, particularly for these couple of objectives that we're running through is, as clinical instructors, how do we develop the cognition for a novice nurse? How do we provide a successful learning environment? And how do we actually be able to bring in all those different levels of theory? We're able to do that through your experiences. You being the faculty's experiences. Again, that's why you're here. Please, please, please. These students want to hear. These students want to learn from you. Share. Have that light bulb moment. We were just talking about light bulb moments. I love light bulb moments. And be able to bring that light bulb moment, even if it's between just you and one student, possibly into the clinical conference at your midday, beginning day, however you decide to run it for your program, for your site. But bring that in, and even to the generalization as, hey, you know, it was brought to my attention or something really neat happened last week, and just bringing it in some manner, it pulls an enlightenment to the student and pulls a position of being able to bring about that teachable moment. We want our students to be able to continually to grow. We want them in the graduate program. I want to see them in the DMP and the PhD program. We want these continual high-level focusing individuals. This provides our continual feedback loop of continuing to advance, 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 and then give back as we all are in this room giving back today. Different methods. So when we're thinking about actually being able to provide a circumstance and how do we actually connect with students, how can we go about doing that? What different opportunities can we give? We can do multiple different things. Excuse us for being 3 inches big. However, apparently from a PowerPoint perspective, I can't put my presenter notes up and this. I'm learning as I go here at the institution, so please forgive me from an inappropriate, unprofessional PowerPoint presentation. However, in all sincerity, how do we go about this? How do we go about making the student there? Having that professional demeanor that we all attain, being able to have that profile, being able to be a good listener and remain objective. A lot of the students, for faculty that have already taught, we all know that the students come and they have just sometimes nothing but pessimism and complaints. Well, that nurse said this to me. Well, this nurse said this. Well, this one didn't look, listen, whoa. By the time you're done this program, you are gonna have a license to save a life or unfortunately really create a really bad adverse event. We need to take that back. We need to leave that student-nurse perception at the door. We are now nurses, accountable as a nurse, act like a nurse, think like a nurse. And that's one of the pieces we really want to push forward. In regards to any interpersonal conflict, interpersonal issues, again, if it's something, it's best to be proactive. It's best to be able to address the situation in real time or in timely manner. Hi, how are you?
I'm good, how are you? I'm Casey.
Oh, hi Casey.
Hi.
I'm John. How you doing?
Nice to meet you.
Nice to
I'm
meet
fine.
you. No, that's quite all right. So, with that being said, we want to make sure we're addressing it in a timely fashion. This keeps multiple different ideas in check. It actually makes the student be able to have their own reflection on what did I just do? How can I do this different? We always need to be able to provide a positive spin on this, a constructive spin. Feedback, how I've always been taught is try to give 4 to 6 really positives, deliver your negatives, and then follow it up with a positive at the end. Sometimes it's a lot easier to swallow. I said this just actually in one of my recent interviews, and the nurse that I hired, she said, I don't know if I could come up with 6. And then I then said, I don't know if I could actually come up with 6 right then and there. We could talk about how nice and clean your dance clothes are or something of that nature. I don't know. But it's different coming from a male nurse, you know? So with that being said, if there's any issue, if there's any concerns that you feel as though you don't want to address yourselves, then bring that to myself, bring it to the course coordinator, and let's sit down. We'll sit down, we'll collaborate as a team, and we'll be able to provide not only the faculty the support, but the student with the experience that they need as well. Okay? Feedback. Feedback is an extremely important position, as I mentioned. It's the idea of being able to provide that in a timely manner. I'll never forget to share a quick personal stories, one of my worst feedback sessions was I already left the ICU when I was at Children's Hospital, and I went back, honestly, for a little moonlighting piece. And took care of this baby. Baby was withdrawing. I mean, his WAT scores were absolutely disgusting, and I was rescuing him, getting the kid comfortable. So, it now comes 5.5 months later. I tried to moonlight again into the ICU, and they say to me, John, we want to have a conversation with you before you come back. You gotta love those phone calls. Gotta love them. So he said, okay, sure, what's up? And they said, well, there was a concern addressed in regards to how you handled such and such patient the last time you were here. They said, we were gonna try to come to you sooner on this. I said, respectfully, this was 5.5 months ago. I don't even know what I was fed last night. How can I actually remember distinctions for that? So the more I talked to them, the more I remembered, and I don't have an elephant mind, however, at least we were able to bring back, we were able to come forward, my records were detailed enough. And we were able to kind of move forward with that. Again, it was perception. It was the perception from a novice nurse that I then gave report to. And once it was then brought to my attention, I then offered, well, hey, why don't I come in, we can all sit together, and we can use this as a learning experience. The unit themselves, they didn't want to do that, which was okay. But my big take for that, and from my perception, was the circumstance for that patient was handled that day and was handled appropriately. However, can you imagine if that feedback was given to me in a timely manner, how that nurse that I gave report to, how much education and how much timely feedback and how much additional moving forward we could have provided them? It was a missed moment. It was a missed moment, and that was really one of the big pieces I took home from that. So timely feedback is always extremely ideal. When I used to do my clinical rotations, I would think to myself, as far as the midterm evaluation, that was something that was new. Did we have that? Mm-hmm. We did have that? Okay. So that was something that was new, or as opposed to that it's something that needed to be written down. I used to say to my students, your midterm evaluation will be every single day up until your final evaluation. We should be having that timely feedback move right along, and you should know. If we need to have a sit down at midterm, then we need to have a sit down at midterm. And we would do an informality, but there shouldn't be too much more. We should be giving the feedback on a day-to-day perception. All right? And remember, when we're giving feedback, we want to make sure that we're giving the appropriate type feedback. We're giving that objective feedback. We're giving that Susie Q. I'm a big fan of Susie Q. Don't know who she is, haven't met her yet, but we're going to use Susie Q nurse. So, Susie Q nurse, I have observed that, you were doing a head-to-toe assessment, and yeah, you seemed like you had some really good points, but there was some concerns. Tell me about it. How do you feel about it? One really nice piece that we can take home with this is when we're debriefing and when we're giving feedback, remember that it is our job to facilitate the question. The old ask the question with a question. By debriefing and being able to facilitate from that manner, you're usually able to pull a lot more from the student. Because it could be from the student, they had a really good mindset on what they were trying to accomplish. However, they just didn't see that global picture. Our graduates, or graduates in general in regards to the nursing population currently, I was just reading, is like 35% for the individuals that are graduating that have any type of critical thinking skills. So, looking at that again, Is it just the individuals that they're not graduating, or is it just a mentality? Is it a perception? However it is, whenever I think critical thinking, I always tease and I say I think of like nursing common sense. But that's the piece that we really truly need to make sure we're drilling home with the undergraduate students. Some different tips that we can look at, some different tools that we can use, is being able to allow yourself that time to have the conversation with them, being able to have the student allow themselves the ability to be able to go forward and truly understand and reflect on what they did. There's so many times that we'll go to give feedback and you're trying to walk out the door while you're giving it. It becomes like almost a negate at that point for not only the feedbackee or the feedbacker, but for that additional relationship, that additional therapeutic bond to be able to be drilled in and actually able to absorb. It's important, just as we're all taught in regards to the closed loop communication, please, please, please bring that forward to your students, okay? The fact that when we're explaining something, making sure they understand and then having them either you re-summarize the conversation or having them re-summarize it back to you, whatever you feel as though is important. It just helps them retain the cognition that you just spent the time going forward and discussing. The students, when we're built in our didactic program, all different pieces of our mentoring and our learning styles are touched. You know, we have them do from a visual, from a tactile, from an auditory perspective. They have didactics, they have clinical, they have experiences, they have case studies. We're bringing it all forward. Depending on what works for one may not work for the other. And like I said, especially to our new faculty or any faculty starting at a new site, forgive yourself. Forgive yourself on your first day. We'll get a rotation your second day. By the third to fourth week, everybody will be flying solo and it'll be a well-oiled machine. The more upfront we can be with the students, particularly in the beginning of semester when I always tease and I say I Papa Bear it, when I say, here's my expectations for you. What are your expectations for me? What can we do from a collaborative effort, continuing that professional conversation, that professional relationship of mentoring to be able to give the student exactly what they need, okay? And something that was important in regards to one of these slides had to do with safekeeping behaviors, all right? Something that there was an incident that occurred not between faculty and student, but between affiliation and student, where there was no boundaries between the affiliation staff and the student population and the faculty this semester. And it caused a really, really hardship, okay, for the faculty member and also for the students. It really kind of let a barrier happen in between for their learning. And the safekeeping behavior piece that to kind of put forward to that was, the staff was literally bad-mouthing the students in front of the students' faces. These students are trying to learn. We've all been there. I really cannot stand that term, nurses eat their young. I think it's such a negative reflection on our profession. But this was something that, and I give it to my faculty member that was there, she tried everything. She tried everything. Conversations, leadership, directoralship. She tried everything, this woman. And it was something that was just the culture that was ingrained there. Should needless to say, that feedback is extremely helpful. And I don't ever want to see one of my faculty members or any of my students in that situation again. So we ignore that site for next time, okay? Needless to say. But ideas like that and situations like that, please loop me in on. It was unfortunate I wasn't looped in until the semester was pretty much over and there was 1 week left. It would have been something, even if this faculty member handled everything the appropriate way, but maybe just a lend the ear from a professional standpoint of me having a conversation. Hey, listen, I'm here. You have somebody to vent to. You have somebody to express your concerns to. You know, what can we do different? Is there anything I can help if, coordinate? So please, let's make sure we're keeping that communicational piece open. And that safekeeping behavioral piece of a conversation, we shall keep it confidential. Of course, we're gonna keep it confidential from professionals in this room. May not be the same, particularly with the age groups that we may be dealing with or the maturity levels. It's just important just to recognize that. And if a conversation needs to be had, just do it off to the side. I am very, very proud to be here today, to be honest with you. I thank you guys for your time so much. Thanks everybody for coming, even though I didn't RSVP. I'm sure I'm gonna yell at later for that. But I did do a sign-in sheet. And I am looking to learn and grow in my role as well. And any piece that you guys can help me with and offer to me, or any different options that you have from your professional development that you can bring my way would be phenomenal. I really want to build a network with our faculty and with our affiliations and with the university, because they're like all the different balls we have juggling in the air, that I want to be able to develop myself, my faculty, and bring everyone in communication to each other. So this way the students have a good experience, our full-time faculty have an appropriate means of communication, and they have the A-team, which I know we've built so far for the semester. So I would like to actually open up a forum, so to speak, and just have different conversations kind of occur. When I first started teaching from an adjunct faculty perspective, we used to actually mentor. So I was hired by Dr. Colby, Norman Jean Colby here in pediatrics back in 2010. And when I came forward, and this is one of my visions for this role as well, was I had a mentor with her. So my orientation day, she did orientation with me. And there are different things that I played forward from my CHOP staff that was coming in, our faculty members that were going to CHOP. But then also we're kind of putting a spin on it, and actually Annette and I were just talking of how wonderful it would be from sharing all of our experiences from a multidisciplinary standpoint. And also to the point that Liz and I were speaking in regards to knowing that if you have a senior person at an institution, at one institution that you're at, Chester County? Yeah. So I have 3 different faculty members there. Having everyone know kind of, hey, Liz is there, she taught last semester. Let me just find out what happened with Liz, so this way I just have, even if it's a simplicated question. So also different pieces we can pull from a networking perspective with that is what worked and what didn't work from a case studies perspective. So Annette and I were talking with that. So can I bring the forum back to you first, if that's okay? Sure. In regards to kind of what has worked for you in the past from a clinical student, what has not worked? What are some barriers that you may have faced? What are some challenges you may have faced? Have you overcome them? Is that okay? It's a couple different topics.
So one of the things we talked about is going into a new institution. I do Saturday clinicals. So first of all, it's not in my health system, so it's a whole new health system. It was rather antiquated because they were all paper. They had just been bought by a large corporation, so there was a lot of difficulties along with staff. So I think in the beginning it was just trying to kind of get your foot in the door and establish a sense that, I'm here to help you guys. We're not staff, and I think that was the biggest struggle is we're here, we're paying for tuition, we're paying to learn. We're not here to do all your assignments. So once we kind of got that through, getting the students to understand that we're guests in this facility and that each day they're there in clinical is really a job interview. So I always say to my students, just because I'm not there, I've been here 5 years now, they know to come get me and say, this was the worst group of students you've had in 8 years or 8 semesters, or they'll say, this was the best group of students you've ever had. So one of the things John and I were talking about is, well, how do we know that this is the best group we've had? In the past, we've never, at least I haven't gotten any evaluations back from my students. I mean, I know at the end of the year, you get, end of the semester, you get your thank you cards, and they kind of put little things in there that they learn, but it would really be nice, I think, as an instructor moving forward, what works, what doesn't work. So when we did post-conference this year, because I had to double clinicals, we did bedside email communication, where my morning group brought they gave reports to each other, then they went into the patient's room and they said, Mrs. Smith, this is my classmate Debbie. Debbie's gonna be taking care of you from 2:30 to 9:30 tonight. I told her you were having trouble with breastfeeding, so Debbie and I came up with some strategies. Debbie's gonna work with you through the evening now to make sure the baby latches well. I also told her you're having some problems with constipation, so she's gonna make sure you get your stool softener. And then they kind of give the report, and then they come back, and it took us a couple weeks, and finally one of my students emailed me and said, wait, I have no idea what I'm supposed to do in bedside communication. So I wouldn't have known that because I assumed we were doing well. So by taking that step back and saying, what can we do better, it really was kind of an eye-opener for me. So I think helping those students not only just meet the tasks of the day, but helping them to be better students at the end of the semester. So one of the things that worked for us in a summary is bedside communication and role playing. This is one way to give a report, but this is really what it's going to look like in reality. So I think evaluations from students are really key. OB went this year with, or 2 years ago, with a weekly reflection. We used to kind of say 3 positive, 3 learning experiences, things like that. And I just found they were cutting and pasting all the time. So I saw this one about 3 weeks ago. Well, I'm like, yes, indeed. So now it says, basically, tell me briefly about your day. Tell me what you really felt strong about doing. Tell me what you think you really need to work on, and tell me what you're going to do to work on that. And then I get it back, and then I write back and say, yeah, but did you think about it this way? Or, yes, you were spot on. That was great. I love the report you had. And every week they're getting feedback. And I think as a student, they love that part. As an instructor, I like to kind of see, I know what I saw on the floor, but it was neat to kind of see what their perception was. And sometimes they're not quite spot on. You're like, no, she wasn't held because of rubella. She was held because of the beta strep. So it's a way of teaching them back to say, so this is what you took home, but that wasn't quite what you needed to take home. So just try to make it a weekly reflection, like John said, and also the evaluations from the students, keep those lines of communication open.
What kind of questions do we have? Maybe from our new faculty that can kind of get clarified, or maybe have us, you have to excuse me, it's enough standing, shed some light on the topics, or, there's gotta be hesitations and uh-ohs, or, oh yeah, I'm in this, and so on and so forth. So, what do you think? Anybody want to be a brave soul?
I think I would have this conversation after my first clinical rotation.
Okay, that's good.
Because I don't know what to expect.
Okay.
I may have missed this in the beginning, I was late, I apologize. However, is there a site where are we all using the same evaluation tools? Do we bring our own?
Good question.
Is there like a SharePoint, something that we could go to and use?
Yeah, that's an excellent question.
Forms, or?
That's it. What was your first name? I'm sorry.
It's Kathy.
Kathy, okay. So, Kathy, what was your last? I'm sorry.
Montana.
Montana, okay. Oh, gotcha. Okay. So, I remember names. A lot of stuff's getting black and white today. So, with that being said, that's a phenomenal question. The course coordinator is the individuals that structure the course, okay? The evaluation tools, I'm not sure that answer to the point of, is it specific for the course? I would think it would be. Every semester prior to the semesters, the course coordinators go through, they look at their syllabus, they revise their revisions, make any updates, make any changes. There's a continuation that's meeting, I like to kind of give, I hope you guys don't mind, but I always like to give kind of background information on kind of what goes on here at the school. I feel like that helps, instead of us all living in silos, everybody's kind of on the same page. So excuse me if I seem to be getting a little wordy with this. But there's continual faculty development pieces. There was one last week, for example, where they went and the main faculty, all the full-time faculty for the undergraduate sat down and they discussed the course. They discussed the program, what's being offered, what's new, what's not new, what are we revising, and so on. To go on what you're saying as far as electronic piece, once you get your screen names, okay, and once you get your, you'll get a screen name and a password from the IT department here within the institution. You will be put on the list for that course coordinator. For example, Pam Williams for obstetrics, okay? Pam will have a clinical list of all her students. She will have a clinical list of all her faculty, and you will be there. So when she sends an email, particularly to your clinical group or to the students in general, everyone sees it. Andrew, our IT gentleman, is going to come and he's going to, I asked him to put on paper how to forward our emails. So you'll all get a Widener email account. That's the way that I get you into the system to get you paid. Totally honest with you, okay? So you'll get email, you'll get Campus Cruiser access, and so on. I'm a realistic man. I realize that this is a side job for many of us. I realize this is an opportunity that you're doing for 7 hours a week, okay? And I realize how many hats we all wear. Remember when I was actually in nursing school, I always thought, oh yeah, I'm gonna become a nurse, I'm gonna work 3 12s, and that's gonna be it. My God, now I'm working 60-something hours a week, I'm doing 42 different things. Yeah, and I thought I was gonna make millions, but whatever. That's apparently not it too, since everybody's giggling. So with that being said, there will be shared files. He's owning a new process. Him and I are working on a project together. So following this, we're getting taped, I keep kidding, but we're getting taped, and what he's gonna do is, he's gonna take this piece of our presentations, and he's gonna disseminate it to everyone, okay? So, also coming along with that dissemination, will be YouTube links on how to access Campus Cruiser, how to use Campus Cruiser, how to forward your email. I really need everyone, if one of the big pieces to take home with this from an IT perspective is, please set up the forwarding, okay? What that means is, if a student sends an email to your Campus Cruiser, because that's all they're gonna see, it gets sent to your Gmail or your Yahoo, to your telephone. So this way, you don't have to worry about that piece of, did I go on Campus Cruiser, have I checked things, what's going on with grades? It'll just be a notification piece, and it's a way to follow. What ends up happening sometimes is, particularly for snow days, let's say, for example, or clinical, like the Pope, that was when this obviously really came to vision. Pope Day, we actually had a Pope Day assignment. So, Pope Day assignment. So, with the Pope Day assignment, there was a piece sent out that some individuals thought it was university-wide, that clinical didn't need to get made up. However, it ended up going, the legitimacy of it was per course. It was per course. So instructors, or excuse me, faculty were emailing our faculty, okay, but everything goes to the Winder email, all right? So everything goes to the Winder email, and then faculty wasn't checking, our AFs weren't checking the Winder faculty email, because that's one of the last things obviously on your mind, and I can understand that. A way for us to combat that and be able to keep our communication open and keep us have that closed loop piece of communication is to be able to set forward that forwarding. But you will have shared files. It will go directly into that piece. With the shared files also, you can upload documents. So let's say, for example, yes, thank you. Let's say, for example, that you have a really good case study. This is actually ideal for our conversation, okay? So let's say you have a really good case study, or you have a really good, I don't know, downtime piece, and you talk to, I'm gonna use Pam again. You talk to Pam Williams, you say, hey, listen, I got this, take a look at it. She's like, that's great. You can upload that to shared files, and then your whole adjuncts can see that. So they can then download that, and it's another means of being able to have a piece of information at your fingertips for those downtimes, okay, for those downtimes. But yes, that will go forward. You'll have that access and so on and so forth. Good question.
Oh, and do we have an opportunity to meet the other, the instructor for the course, like actually if we wanted to?
Oh, like the other adjuncts?
Or the one who's teaching the?
Oh, you'll meet them in another hour and a half.
Oh, they're gonna be,
Yep,
oh.
yep, we got it all coordinated. So at the end of following my spiels, around 20 minutes or so, Dawn Ferry and or her staff, she's the director of simulation here, will come in. They're going to talk about a typical sim day, what to expect on a sim day, and so on. Following that, I believe it's Dr. Concerca. Is she giving us? No, Andrew is. Andrew will come down and he will present briefly on the IT piece. Pretty much what you and I have just discussed. He's going to go a little bit more in depth with it. Dr. Concerca is going to give a really, really nice talk on the relationships. And then following her will be all the course coordinators. So every course that everyone has been contracted for, that course coordinator will come through, except for population health. I know she has met her colleagues as well already. Okay? So they'll end up coming forward. You'll be able to get the syllabus with them. You'll be able to find additional resources. I know some of the course coordinators actually order textbooks for all the faculty. So this way you have exactly what's kind of going forward and what's being taught. I've had some faculty members, some of my faculty members say to me that they would either teach, has anybody done this? They would either teach what was going on that week or trying to like bring that into clinical that week, what was going on with the syllabus, or have it even been a 1 week lag. Any of my senior faculty, have you guys done that? Trying
I
to
used to do it when I taught
yeah,
you, yeah.
trying to kind of coordinate things, how
I
they
used
kind
to
of go.
assign the students something within that chapter, and
Oh.
then they would present it at post-conference. So if they were learning cardiac, I'd give each person something.
That's ideal.
And then they'd present it.
That's ideal. That's another really good point too. Thanks for bringing that up, Casey. Another really good downtime piece is that, or let's say, for example, you have a student that comes to you and says, Casey, I don't feel good. I don't feel good, I got sniffles. And you're doing OB, and you do not want that kid around a newborn with sniffles. There's an ideal where you can continue to keep that student in clinical, okay? Obviously at your discretion. This is your clinical group. I want everybody to have that autonomy. I do not micromanage, I'm here to help and facilitate. With that being said, maybe have them do an alternate assignment while they're there at clinical, such as that. Listen, because if they leave, they have to still make up the clinical time. And they can then present that forward. Did you do it like real formal? I've had instructors do
No,
it.
it was very casual.
Yeah.
Yeah, and it was maybe like 5 minutes the student would
Yeah.
just present. And so it was helpful to the other students to have, you know, a little breakdown of like CHF.
Yep.
You know, cardiomyopathy type thing.
That dynamics and that synergy is something that they're trying to create in the didactic portion here, that peer-to-peer education. So just to kind of put that caveat to everybody as well. All right. What other questions, guys?
One more.
No. That's why we're here.
In your
As I fall.
past experience with instructors, how about feedback to us? Like, how will I get feedback from either the students or when you have had maybe some issues? Like, I know that your example was like a culture issue, but what if the students aren't satisfied or they want more or they're really happy? Are they coming to you with that, or are they going to, and then what?
How does that?
How do I get that information?
So, and this is something that you and I talked about. So this is definitely something that I need to perform and get this done.
Yeah.
So how it's been in the past is evaluations we get forward, the final evals. They write their comments on there, you know, so and so and so and so. And I don't know if it's just something that hasn't been fed back to the faculty, so our faculty, the AFs, so to speak, or it's something that's just gone in the drawer, to be honest with you. But that's something that I can promise I'm gonna facilitate getting back. If there's a concern, and I've had, when I stepped into this role at the end of September, okay? And when I stepped into this role, there was a couple fires that we needed to put out. So some of them had to do with circumstances like that. So what I do is, I'm a conversation kind of guy. So I'll usually either stop out to the site, because that's usually one of the best ways to do it, and either that becomes my invitation, like, hey, why don't you stop over to my office the next time you're on campus, and we kind of just do, you know, an informality, an overview. If it's something to the point that it needs to be a full-out coaching session, which was one of these circumstances, we do that as well. But again, for me, it's a conversation. Because we are all learning every single day. That's why I actually really love this profession. I was still hoping for the 312s. That's obviously not happening. But one of the main things that I really love about this profession is you're learning every single day, okay? I don't have all the answers. I'm happy to try to find them out, you know? And in regards to a coaching and that mentoring and that peering thing, that's why I'm here. That's why I want to learn from the individual and so on. We want our students to follow chain of command. They need to have that instilled to them. There's some type of concerns with the current generation. I'm sure some of us have seen it where it's almost that entitlement and that I want to be spoon-fed. But again, you're paying all this money a year to get this wonderful education. This is an extremely hard program, and we want individuals that have that dynamics, that have that driven. Okay, I want somebody that wants to learn. In my perspective, I can teach. That's why we're here, right? I can teach, hopefully, anyone anything, okay? However, I cannot teach someone passion. So, from a coaching perspective, if there was a concern from a feedback for any faculty, good, bad, and different, it would be the point of, this is what I'm observing, this is the conversation, or what's your kind of thought? A lot of the stuff that ends up coming back to my desk is so silly and subjective. It's like, did I really just have to open that email and not take an extra sip of coffee? So, with that being said, the big thing, particularly from a faculty standpoint, that I really would like everyone to take home is remaining that objective individual and seeing kind of what's going on with the layers. if there's a concern with feedback from the student having an issue with the faculty, that usually it'll get brought to the course coordinator, okay, being honest, because they're the individuals they see twice a week.
Yeah,
Okay,
that's what I was
teaching.
wondering.
Yeah,
They know who to go to though,
Yes.
and then if there's,
Mhm.
there's a process and.
We end up asking, we always say, did you talk to your faculty member? Usually they'll say no. They'll say, talk to your faculty member, try to work it out. We're aware of it. I'll get looped in on it. I'm gonna tell you, some of the most common, and this is actually, I always find this funny, but some of the most common concerns that are expressed by the students is, I'm not getting enough clinical time. And it's the idea of the faculty, us, are coming, the idea of, my God, these kids have so much going on. They have their studies, they're trying to go to work, they're trying to pass, and we think we're doing a good nature of saying, all right, listen, guys, why don't you scoot out an hour earlier? Go ahead and scoot. And that's why it was my drill home in that 7 hours, teams. Because they'll end up saying, hey, go ahead out. And then the students will then come back and say, well, I didn't get enough clinical time. We want an extra day, blah, blah, blah. They're kind of the loopholes. Did I answer that okay?
Yeah.
Okay, cool.
Just to reinforce that too, a lot of times, you'll get an email from the course coordinator saying, hey, students came back, said they saw a great delivery, and this and this happened, I just wanna tell you thank you, and you're like, wow, that was just part of the day, but, you
Yeah.
appreciate the feedback,
Well, that's
so
good. That's
I
just-
couldn't speak for your discipline, but I can just say, our course
Sure.
coordinator, and I believe Pam's always great about, sending some good,
That's good.
positive vibes.
Yeah.
Yeah.
As long as the students know
But
if
the
they have
students are good at
problems,
saying
like,
it, too.
that they could go to somebody.
So I feel like the
and
students
report
are good
out.
at saying it too, like they'll
Yeah.
tell you exactly what they want
Yeah.
to say.
Yeah, you'll see it too, particularly when you're doing your post-conference. And if you use those tools of facilitating, being the listener, let them being the talker, it really does help. Highs and lows is good. Hey, listen, what was your high today? What was your low today? What did you like today? The use of journals, I believe all of the programs do journals, okay? The daily reflection journals. You can use that tool how you see fit. That tool is a tool for you and the student, okay? It helps you gauge where they are in their learning and their cognitive clinical development. I used to do in my rotations, was for my journal, I used to say to my students in the beginning, again, a little unorthodox, I used to say to my students in the beginning, write anything you need in that journal. This is the idea that if you don't want to communicate with me face to face, write it in there. I don't care what you put in there. Just put it in the point that it's going to mean something to you to help your learning. And if it's something that I can do and you don't feel comfortable giving me the feedback, then put it in there. If you want to write an assessment and ask me to check the assessment, put it in there. What I like to see in the reflection was things such as the point of the components that they're getting it. They're putting it all together from a psychosocial perspective. I would say, what worked for you that day? What didn't work for you that day? What were you surprised with? What weren't you surprised with? I had one student in general, I remember a couple years ago, that he was a firefighter. He was a firefighter, a volunteer firefighter, okay? And he lost his roommate. I saw this individual was a glowing, bright nurse to be, and all of a sudden everything just changed. I wasn't privy to any of that, that's all private type stuff. But he wrote in his journal something, I don't remember exactly the detail, but it was something that hinted to this, that I was at least able for me to say to him, hey, listen, Jim, you all right? Is there anything I can do? Do you need anything? How's things going? How's school? And it was just something as simple as that allowed him to open up to me. And honestly, I asked him if I could share it with the faculty, and he did. And he allowed me to share it with the course coordinator. And it helped because his grades were slipping. So it just kind of helped shed a light. So the use of journals for personal reflection, academic reflection, and so on are really, really key. Are really key. What other questions?
I'm not actually teaching at a clinical site, but I'll be doing skills lab here. So like what kind of evaluation tools and like do these shared files still apply to the same thing? And I know it's like less time.
Yeah. So Dr. Schwartz, Rose Schwartz is the one that organizes all of that, and I believe she has a cohort as well, a committee member as well, I believe, don't hold me to it. you'll have the exact same stuff. Because you'll have, you're teaching health assessments?
The
Pharmacokinetics?
Pharmacokinetics and a health assessment.
Okay, so when I taught pharmacokinetics, it was I taught the very first pharmacokinetics course. So, and I'm sure it's come a long way since 2012, but what it was for me was literally like a book, like a workbook, that's the best way to put it. It was a workbook that had all the different med calculations in it and so on and so forth, and then there was a syllabus of a week-to-week breakdown of what you would do, so you would have that. I don't recall if I had to do evaluations.
Yes, you do.
You do? Thank you, so there you go. Thank you. Did I miss anything there?
No,
That's
and
like
I
upcoming?
had to tell you, you get the textbook and a workbook, and it's broken down by body systems, and you watch a video every week, and then you perform the assessments and things.
Okay.
And then the end of it all is a head to toe, and they perform it on each other, and they actually do it in a sim lab without, they've changed it, there's no instructor, there's nobody in the room. It's videotaped, you hand in a flash drive, and you get the flash drive back, so there's no, yeah, it's very interesting. The students seem to like it better because there's no like somebody hovering over me. But of course, in clinical, you're hovering over them to do it again anyway. But it's interesting.
I'm not.
It's an interesting way to do it.
I'm not NP trained. Our NPs, did they do something like that at the graduate level too?
Yeah.
They did. I'm sorry, I really need sunglasses. Wait, they did, I mean, obviously they did health assessment. Did they do like a video recorder, or it just kind of depended on the program, or it was live?
Video.
Live
It was
people.
live.
Live, okay. I hear different things from different programs.
Yeah, see some of it, watch it on.
See, I was looking at the
It
list
gets
and it
mind-numbing.
doesn't look like there's anybody coming in later to talk to that's doing the clinical skills lab.
Has anyone taught pharmacokinetics that can speak to that even more in the last year or so? What's that?
You've got the workbook.
You got the workbook, okay, so it's the same thing.
Does, yeah.
Okay, all right, it's the same thing. Okay. Different ways to decrease anxiety for your clinical day. When you guys go and you do your orientation, I can pretty much promise you that your students get, once you have your student list in Campus Cruiser, email them. Introduction, little bio about yourself, some type of exciting type routine. Really excited to get there, it's a wonderful site, I saw it, blah, blah, blah. The students are going to focus on where to park, where do I eat, right? What do I bring? Do I bring food? Do I bring a stethoscope? Do I bring a blood pressure cuff? Do I bring my dog, cat, or hamster? Crazy stuff I would get. Where do I put my stuff? Do I have a locker? Do I have, am I gonna get a paycheck? I actually had that question asked me once. No, you're paying, you're not gonna get paid. So, finding out that information for the students when you guys go do your orientation is key. The more you provide them, have them then bring back any information. Every semester when I would start a new cohort, after all the years I used to have, literally, I think it was 10 or 11 documents. Hey. I had 10 or 11 documents, and I would email them the 10 or 11 documents, have them go through it, print them out, bring them to clinical. Killed a couple trees. However, on the same person too, they were able to have that right in front of them. So that would be one piece that I would get.
And John, I think one of the things I've learned, and I've been teaching before I was at Widener, but the whole thing of consistency, that if you have a document that you give to them to say, these are the expectations, this is what we're, as opposed to it just coming out verbally, and, the saying, what's said and what's heard can be very different.
Correct.
And what's written, what's read can be very different, but at least if you have the document to say that this is the way it is, so they can't come back to, well, I never heard that, or I didn't realize I had to turn this in at this,
We do the course, the clinical contracts also. Talk to your course coordinators, okay, in regards to that. If we need samples of that, if the course coordinator requires that, do you know, is that required for every course, the clinical contracts? With the students, with the students and the adjuncts for the institutions, or is that kind of staff course curriculum? So that would be a conversation to have. I know pediatrics does it for a fact. Any of my senior faculty can speak to it, that'd be great, but that's a good way to do it. They have a copy, you have a copy, you keep a copy, you send a copy. Does anybody have any other questions? All right. Without further ado, it's Professor Dawn Ferry. She's our director of the simulation department. Yeah, yeah. You know how to use it better than I do. Perfect. Thank you.
Not yet.
Actually ended up.
You know what, if you wanna, I'm not gonna be at my handout, no, I'm not. Okay. So if you wanna have a couple minutes, a few minutes, and just let me go through the stuff, and then.
Okay.
You All right, I am Dawn Ferry. I'm the director for the Center of Simulation. So some of you may know me. I see a lot of new faces out there. I'm going to talk about the simulation, also the labs. Is anybody doing labs in here? Teaching labs? Okay. I'm going to talk about that and a couple other things about our simulation center and our labs. So every student that's in clinical will have a simulation day. A schedule will go out with what the schedule is. They come in, so one simulation day equals a clinical day for the students. They come in for 4 hours. We meet with the course coordinators and go through what sims that we're going to end up doing. So they each get 2 sims. When they come in, they have time to look up, and then they also have, we do like some skills in between. So the faculty do not have to come for some of those. So the ones that do not have to come to simulation are OB, PEDS, and that's it. So OB and PEDS people do not have to come to simulation, okay? The leadership, whoever's teaching leadership, and also med-surg for our juniors, they need to come to simulation with their students, okay? For the OB and PEDS people, we're gonna, some of the PEDS instructors wanted us to videotape and let them look at the videotape, so I think that's what we're going to do for the OB and the PEDS. So we will videotape and then we'll send them out, and that's for you to kind of look at and see how the students are doing, and if there's anything that they need to work on, you could, take that and work on that with them at clinical. The other psych, they come in. There's 2 psych clinical simulation days. So they come in the first day, but the second day they do not. I will make sure that the course coordinators send something else out to you to remind you, whoever needs to come and whoever doesn't need to come. But I will send out a schedule. Please don't email me and ask me where the schedule is. We try and get it done, but when we have labs, clinical sites that we either drop or we have students that we combined, I have to wait until the beginning of the semester to actually get it out. So I think I have everybody's email, so I will send an email out with all the schedules on there, and it will also go in shared files for the students. So the students can print it out if they want to. I'm not handing out individually. I will send it, put it in shared files, and email them and tell them that's where it is. All the students are expected to come to simulation, even if the instructors are not there. It is considered a clinical day for them. If they do not show up, they will have to make up the simulation day. Please
tell them to come and contact me if they're not going to make it or whatever that may be, because then it goes to you and then it all gets mixed up. So just have them come talk to me if they can't, they're sick or whatever. So they will make up that simulation day. All right, so that is, anybody have any questions on simulation? Nope, okay. Labs, the labs, whoever's teaching the labs. So there will be mandatory lab days for the students to come. So if you're teaching pharmacokinetics, they have to come for 1 hour open lab, and health assessment, they have to come for 1 hour open lab. So they have to come for a total of 2 hours. They kind of start getting confused on this when they come back. I will put up open lab days. I generally don't put up the open lab days until a little bit into the semester, because they're not really doing that much, and so then they blow it off until the end of the semester. So I'll put them out there, they sign up themselves for it, but they are mandatory and they do need to come 1 hour for each. Now that doesn't mean that they can't come more than 1 hour. If they choose and they want to come again, or they want to come practice stuff, they're more than welcome to come to another open lab. But they do have to come for an hour of each one. We will also be doing simulation for pharmacokinetics and health assessment. That will be at the end of the semester. I believe it's like really towards in April sometime. I don't have the exact date yet. The students, we will actually come into the classrooms and the students will actually sign up for that one themselves. We'll give them time slots and they'll actually sign up. So that won't be until like April, the end of March, that they will sign up for health assessment and pharmacokinetics. And the instructors does not have to be here for those simulation days. The students just come to the simulation at the time that they sign up for, and then they leave afterwards. We will also be doing, and I'm not sure if it's going to be in pharmacokinetics or if I really get it together, we could do a video, but we will be coming in to the classrooms to kind of introduce simulation and also like the labs and everything to the students. So how the bed works and the lights and everything like that, because they sometimes come into simulation and then they have no idea how everything works in the labs. So we'll kind of come in and just give like a 15-minute intro to that in pharmacokinetics for that one. So that is it for the labs. Any question on labs? Anybody that's teaching the labs? All right, so I'm going to put this up in shared files. I didn't make copies because I'm not, we're getting yelled at for killing too many trees here. So I'll put it up in shared files in each of the clinical sections, and I can also probably email it to each of you as an attachment. So this is our learning prescription that we have. So if you have any students when you're in clinical, every student in clinical is not know everything. When they go in there, they might have trouble with some different things. So you can send them back to the lab to practice different things. If they're having an issue with blood pressure, you can fill this out, email it to me, or the student can bring a copy in and put the issue and then say, you know, do you want them to come out? What do you want them? They can or cannot attend clinical. I mean, if they're really not safe, they probably shouldn't attend clinical until they come in for the remediation. They usually need to set up something within 48 hours with me after you've given them this remediation form. And then they'll come in. I have one of us will go over, have them practice, go over everything with them, and then we actually will send you back an email telling you, you know, what the student did, how long the student was in here, you know, do they need to still remediate on something, and we'll get that back out to you. So please don't hesitate to, you know, use this and send the students back here if there's really something that they need to and you don't have time in clinical to go over it with them or whatever. That's what the labs and the simulation center's for here for the students. And I don't think they know that, and I sometimes think faculty do not know that either, that that's what they're there for. I'll make time for them to get in there. We're very busy, and we have a lot of students that come in and out of the simulation center we do have other schools that come in that use our simulation center, and also, all the other clinicals that come in. But I want the students to know that they're more than welcome if they need to practice something to please come in and practice it. And so that also goes for the groups. So I know, anybody OB in here? Okay. So I know that I was talking to Audrey and Pam about some of them wanted to come in and do kind of a first day clinical in the lab to go over skills and stuff like that. So for the ones in OB, and this goes out to anybody else that would like to do that too, you can just email me with the date and time that you want to come in, tell me how many students, well, everybody should have probably about 8 students, but tell me what supplies you want out, what you're going to do, and how long you want it for. So if you want to come 8 to 12, then just let me know that. And so if anybody wants to come and do that the first couple weeks, or even in the middle of the semester, you see that a lot of your students are having issues with something, and you want to come in and just do a day in the simulation lab or one of the rooms, then just let me know, email me, and let me know what you want. So that is it. My office is right here on the 2nd floor, so I'm 209 right here. And my email and my phone number are on here. I do have a Widener email too, but everything gets forwarded. So please feel free to contact me. Any questions you have, any issues or anything like that. See, that was real fast.
Very fast, I'm impressed.
Just for the maternity faculty who's, just 2? 2 of you, that's it? Maternity, who's teaching maternity? Are you teaching maternity? Okay. I just have a form for each of you. Okay. This is a sample of student clinical rotations. And it works really nicely if you're able to coordinate this
discuss something from OB. If you guys want to take a 10-minute break,
the nursery,
okay, you can do that.
so that you don't
And
have
then
to.
Andrew will be down from IT to kind of go through that stuff.
Okay, so this is just a sample. That you just work with. And then one of these will be.
I don't know when you sleep and when you wake up, but I just wanted to make sure. Just want to make sure, just one more.
Oh, okay.
As soon as you walk in, so right to your left, you see all this stuff. It's amazing.
But it's like, I don't remember who it is. Oh my gosh. Imagine if it was It's like,
And it's just a.
So I think you forget, that be like that.
Simulation, you'll get out of school, you're done, simulation, the word 12.
What that was.
I see it, and then use it exactly, whatever.
They don't hold it, just do Yeah, once in a while, I do like, I'll crawl out every once in a while.
That's what I was gonna show the newbies.
Bronchitis.
Well, so good to see you.
Good to see you. Probably once a year. It's not too frequent.
It's all right.
It's not
It'll work.
water.
It's caffeinated, right?
Thank you.
And the students will be here with us, right?
I texted him. Casey is here, she just sent her.
Wait, where's she? She's down.
As soon as you came down, take the elevator Well, I didn't think, I mean, that is really good attendance. One of the came in, they're like, sure. Take down the elevator right to the left. What is it? They go to. There you go.
Balaji and I went to our master's program together.
Oh, really?
Right? I was pregnant.
Your pajama, I'm thinking you're Balaji now.
I remember, yes.
Well, my youngest.
I'm going down first, actually.
Oh,
So I'll
okay.
see you back here.
All right.
Thank you for your snacks. Oh, yeah. Appreciate it. Oh.
I came out of the house with, I thought it was so good. I came out of the house with like a full blue cooler, I had like all
That
set
was
up.
it?
She's like,
There's nothing wrong with that.
No, I don't, it's just, what do you do? You know, I thought I would take it, like, no, you know, we can have it.
Is she a nurse as well?
No, she's home like.
Uh-huh. Okay.
Actually, TPA, the first one goes up to the,
How many do you have?
Two.
Uh-huh.
4-year-old.
Oh. I have a 4 and a, I have a 2, 4, and a 6. Yeah, well now it'll be 3, 5, and 7. Uh-huh. It's a lot of fun. A lot of fun.
Yeah, 3
they're very grateful to see you. They just had students with just they'll go a lot of tests. Once they're straight up.
How are you? How's things? All good? Questions, right?
No, not right now.
No?
It's exciting,
Okay.
something that you
Good.
some of the
Yeah, we're gonna have Drew's birthday.
I don't have any of the clinical instructors here, and I just talked to Don Ferry, he said they actually have a meeting towards after the holidays, for the piano classes. I have tickets to the piano boys choir today at 7:30, so
That's
I'm
fun.
sure that-
Yeah.
But it's like if you're someone there, I think
Yeah, I would just, and the way it'll be for like the rest of the team. Once everyone's done. I just did
I just wasn't sure, there's like,
nobody here to talk to. Yeah, take advantage of it.
So I just went and talked to Dawn to find out about, you know, getting into the lab, so I can know where everything's at, 'cause it's been a long time. You know, the books and materials and all that stuff, so she went and
Oh, that's perfect.
so yes, I appreciate
And you're good with our conversation earlier?
Yeah, exactly. And I was gonna touch base with Rose just to see what other times she still has, I might be able to.
I didn't know what time you had that was. I was like,
Okay, so maybe you jump out of here.
I was like,
That's what I would do. That's what I would do.
What else are we still covering? Okay, so I have for that.
And then,
God, I had answers. I didn't know them all. And
she's giving you,
the next week. Yeah, because a lot of times you put up, it's on
Yeah, okay, awesome. And then maybe when I'm done those, I can go up, she's not leaving early.
she may, I think she had like a 4-hour meeting. But I don't know if she's gonna enter. You know what I mean? She's still.
Maybe I'll just send her an email.
Whatever works for you.
a lot of insight into what you can do.
I have a question.
Like, I'm not sure you put the together, but this is not separate. Write down items.
I never found any instance, but I always thought it would be good to have. And I've seen it in other institutions where it's a Widener header test that says, this is institution, this is instructor, phone number to contact the instructor, these are the students, this is the side of the student. And I've seen it in my own class where I work. It's on the counter in front of the secretary. So if they want to know what student has this person, I want to know, like, the secretary's like, oh, the call bell's ringing, and then I don't have to call no, the student, I can call that, right? Do we have? So we can just make our own then? Okay, I was trying, the one that I saw was like a standard one, and then when they use, it's out in Lancaster, you know, and it was nice because it was just handwritten in. And I know West University used it at the nursing home that they had. And it's much easier at nursing home. It's much easier at a nursing home. The same residents. So it's just like this resident is this resident, this resident, so like, but whatever.
Yeah, I don't know if there's one already. I used to myself last time. Like I wanted to do time sheets, I guess time sheets for like my students.
And I could, I bed sheets on, dry drops, this was just for that teacher.
And then they go back and they play around the station.
If someone had to find that instructor, so like my phone was in my car, I need to find it. And the student had one, so they know who's assigned it to, so there wasn't a question.
It's
Any problems with the course?
So here's
Yeah. Just use the letterhead. Okay.
just make your own grade.
Right.
Yeah.
Yeah, okay, so it's okay that it uses a letterhead or something like that.
Yeah, I mean, you can even use it for like recommendations.
Some of the recommendations that I've been asked about.
And I just, yeah,
online, or like, can we use?
Oh, really? Oh, yeah,
And
yeah,
it said to me,
yeah.
I just do an online thing, it's not a letter, and it will just have.
Let's try and give it to you. Okay, alright, as long as you're ready. Alright, let's try it. Yep, and this is another adjunct.
Well, and then,
Oh, it's the actual eval itself.
Yeah, I think they're trying to get everything built.
yeah, exactly. Right. Like this woman has
Is that what it is? I can tell. Can you tell? I have to. So yeah, I don't see. But just do that, and then if you were to say, look, if you were to consider this here with it, but if you so if you were to even. Hey.
How you doing?
Good, man. How are you?
Good. This working all right?
Yeah. Thank you.
Was he okay?
Yeah, it was. I ended up going with this.
Okay, all right, good luck. Yeah, I am.
So if you did that, right? And then take you know what I mean?
Yep.
And then you can just kind of cancel and go. That's what I do. Yeah.
I just wasn't sure if there was one there, I could remind it, yeah, that you don't know what one. Okay. Okay. Right, and I made a template to.
Yeah, and they're gonna say great job.
Not done.
You know, that would be mine.
Okay. And that's not just that, that's if they're using any book that offers software, looking for any book. Anything Campus Cruiser, yeah, so that's something that we can mention.
Okay. Could speak to all that stuff. That would be great. I also gave an introduction in regards to who we are, so to speak, and you and I work on a project together to more streamline
Okay.
perspective.
Yeah.
Colleagues, did everyone have a chance to sign? Sign? Everyone sign? Yes? We're on at 3:30.
Yeah.
All right. Colleagues, we're going to bring this back. We're going to move on with the last portion of our day. So for the last portion of our day, what we're going to talk about is we're going to talk about the different opportunities we have from an informational technology standpoint here at Widener University. All right, and Dr. Kasurka is going to give a presentation on integrating the psychosocial concepts into our clinical facilities. Okay, and then following her talk, our course liaison is coming up, so our full-time faculty will come up. You'll be able to meet with them respectively. And then everybody gets out of here and hopefully not stuck in traffic with that. Okay, so there was one other topic I wanted to mention. The university just was able to get this software granted to us. Excuse me for sitting. Was able to get this software granted to us. It's called Adjunct, all right? And the Adjunct software, Andrew, you stop me if I'm wrong. The Adjunct software, it's a professional development software to help clinical faculty. Now, the course itself is 40 hours long. Do we get paid for 40 hours? No, we do not. However, the idea for this free software is the idea of you can go in and pick and choose what you want to take and what you don't want to take. So let's say, for example, there's a spot, I haven't had the opportunity to play in at Sandbox yet, but from what was explained to me is there's a spot that say on how to shake up clinical debriefing. So you can go and take that mini module and get some ideas off that, okay? I am not certain, I can find out, is it PSNA approved, do you know? So CEUs. So, but I know that it's something that's offered to Widener, and Widener owns this rights currently. So it's a piece of software that's out there. Andrew's gonna go through how you can get on, how you can gain access, and so on and so forth, okay, with that. So, without further ado, this is Andrew Boble. And Andrew is our informational technologist here within the School of Nursing. He is ours and only ours. He and I are working on some new projects, trying to loop in our adjunct faculty, our full-time faculty, and myself into the actual informational technology piece. He is agreed to own the communicational piece from there, so that this way, if you have any ideas, any issues, you just came up with a really great idea and you want to upload it to Campus Cruiser, he's your go-to. Different pieces that, let's say for example, our colleagues that were unable to be here today due to scheduling conflicts, we're going to, as I mentioned, take our presentation today and be able to disseminate that out through them. All right, so without further ado, take it away.
Marvelous. Like John said, my name is Andrew Boble. It's B-O-B-A-L. I am here as much as and even more than most full-time faculty, so if you need me, I am reachable, and everything always comes right here anyway. So even if I'm not here, I can help you probably from where I am at that point. I might not answer immediately, but I will answer fairly quickly. I do recognize some of your faces, so I'm so happy to see people back for the spring semester, and obviously a lot of new faces, so some new stuff today. Please, if I am going too fast, or if you have a question while I am talking, just let me know and I will be happy to slow down. My background is a 4th grade math and science teacher, and I had a very limited time to squeeze all that information into a short class period, so I tend to talk very fast sometimes. So please, again, if you need me to slow down, let me know. A lot of things we're going to cover today. First, basic stuff. I know that a lot of you use technology every single day. I know that a lot of people are very comfortable with technology, and others of you might view it as the black cat walking across the street. A lot of different levels, and that's perfectly fine. Hopefully, some of the things that you see today will be fairly new. Other things might be, oh yeah, I knew that, and some things you might want to dive in and try right away. I'm going to try to give you a couple tools to make your life a little bit easier on a daily basis, because we know that not only are you doing this, but you probably have your regular gig, whatever that might be, on top of your family and everything else. So let's give you something to make your life a little bit easier. One of those things that can make your life a little bit easier is our learning management system here on the university campus. It is known as Campus Cruiser. You might hear some people call it your LMS, that is your learning management system. It is very similar to things like Moodle and Direct to Learn and Desire to Learn and all those things that you have for online platforms. So if you've used any of those things, a lot of those features are built into Campus Cruiser as well. Very basic. In order to get to Campus Cruiser or in order to get to your email or anything like that, you can always start off at the Widener homepage. Here is the Widener homepage. You can see I have Campus Cruiser up here in our green box, and then right next to that is our other buddy that we're going to talk about today, which is your Woomail. Both of those things kind of shake hands and other times don't really like each other. So we'll talk about both of those things today. First things first. Campus Cruiser. Your Campus Cruiser login is your login that you receive from the university. It's the same login that you use for Campus Cruiser, the same login you use for Woomail, and everything else that you need for university purposes. Thank goodness we don't have another 5 million usernames and another 5 million passwords. It's all the way across the board when you're using your Widener things. Some things that you can find in Campus Cruiser that might make your life a little bit easier are things that you might use on your phone, or things that you might use for your family, things that you can use for your students and your class as well. Things like calendar for upcoming dates and locations where you need the students to be or what time you need them to be there can be a very useful feature, whether there are assessments or different things that need to be turned in on time. Those can all be found within the calendar. My offices and my committees, you have specific groups that you are part of. You are part of the School of Nursing Adjunct faculty group. We're going to look at that group today. When you leave, and hopefully by tomorrow, you will all be part of the the School of Nursing Instructional Technology group, and you will be a part of that group and committee as well. Those are more for the communication amongst myself and your colleagues. The committees and offices aren't a place where you would find a lot of students, unless it is some kind of student organization. But as far as going to find paperwork that you need, or people to get in touch with, or resources that you might find, those things can usually be found under your offices and your committees. After that, another great way to stay informed is your campus announcements. These would be the announcements that come from actual campus, not you putting out what you're trying to tell the students, what the campus is trying to tell you. So different events that might be going on. I know they say it's going to be winter soon. I don't know if that's the case. Whether there might be some kind of snow delay or ice delay or something that might be happening in the neighborhood that you might need to stay away from, something like that. All that stuff comes from campus announcements, and that can be found in Campus Cruiser as well. And last but not least, probably the place you'll spend the most time is obviously your classes. Your classes you are already assigned to, and your classes will be in Campus Cruiser for you. When you're put into a class, there are obviously certain roles that you can have inside the class. You would never have the student role, but you would have the faculty role. The faculty role allows you to put up announcements and adjust the calendar and see the grade book and review submissions from students. Okay, so you have all that stuff on the back end in order for you to work with. And we're going to look at some of those things. When you go into Campus Cruiser, there is a whole lot going on. Some of you, if you've been here a little bit longer, your page is probably a lot more hectic than those who might just be starting this spring. If you've been added to a couple committees or you've had classes in the past, a lot of that stuff might be there. And this is all what, we're all going to see the same thing, except it might be moved around a little bit. But you all have a dashboard, and this dashboard can be kind of moved around and add things and take things away. You have all your places where you can be up top, as well as the most common things, which we would call our quick links up at the top. It looks like a normal browser. So those of you who spend a lot of time, whether that's in Google or Yahoo or anything like that, it's a normal browser. Okay, anything that you might do inside of Campus Cruiser, we can come back from. So don't be afraid to go in there and poke around and look at the tools and click on things and add things and look at your classes. If you mess something up, click the back arrow. If you really mess something up, give me a call. And hopefully we can get back to where we need to be. But don't be afraid to go in there and just poke around. We have full-time faculty here in this building who up until this semester did nothing in Campus Cruiser. Ugh, you gotta be kidding me. No syllabus, no classes, no grades, no grade book. I just got here in August, and when I walked in and I saw the first professor I met, she was walking around. She had a notepad. She's walking around, and I look at it, and I go, "What's that?" She goes, "Oh, that's my attendance." Every day she walks around with this notepad, and the students sign in on their notepad every day. I said, "Did you ever go in Campus Cruiser and just click off the people's name?" "Oh, I didn't know I could take attendance in there." So just find those things that make your life a little bit easier, okay? And some of those things might make your life easier, might make the person next to you's life harder. It's whatever works for you, but there are a lot of things in there. So beyond our conversation today, go in there and poke around a little bit and see if you can find something that'll help you out. Okay, here comes the fun part. As an employee of Weiner University, you have two, not one, but two email addresses, okay? Now try to wrap your brain around this, because believe me, it's hard for me to understand too. I don't make the decision, I just pass them along to you. There are two email addresses inside of your Campus Cruiser. If someone wanted to send you an email and you wanted to log into Campus Cruiser to see it, my email address for Campus Cruiser is abobel@mail.widener.edu. They throw that, boom, mail in there. Now we also have WooMail, which is Weiner University Mail. We call it WooMail. When someone wants to send an email to WooMail, then it's just abobel@widener.edu. So now that mail portion isn't in there. Guess what? When someone looks up your name, they get both. When a student goes to email you, probably they're going to use the @mail one because they're using the Campus Cruiser platform. You, as faculty, have WooMail. Students do not, as of this moment, have WooMail. So all of the students' emails are going to be whatever it might be, joeschmo@mail.widener.edu. All the students are going to have mail inside of their email. You have mail inside of your email as well. Or you don't. It's whatever one you would like to use. And you say, "Andrew, oh my God, are you kidding me? I gotta pick one?" No, you don't have to pick one. You don't have to use either one of them. You can use your own personal email if that's what you would like to use. If that's what you have set up, I like this one, I'm going to use this one, this is what I'm going to do. But make sure if you're going to use that email, you go in and you forward both your Woo mail and your Campus Cruiser mail to that email that you're going to use. Otherwise, the communications that are coming to you aren't going to get there. You know, me stuck up here in the cyber cloud. I literally had a professor come to me last week and missed over 50 emails this semester because they never forwarded their email to the other box. So, oh, well, I called you about, I never got the email. Oh, well, my grade wasn't, oh, I never got the email. Well, you were supposed to, oh, but I never got the email. Well, that professor never forwarded the email and never went into WooMail. They did everything inside of Campus Cruiser. So here are all these messages, not only from their colleagues, probably the dean, the boss lady, that didn't go over too well, and everyone else, students and organizations alike are sending these emails and this person is not receiving them. What you are going to get today is a nice, I did my best to kind of, I don't want to say dumb it down, but I did my best to make it fairly simple of how you forward in both of those accounts. Whether you choose to use WooMail, then you need to forward your Campus Cruiser mail. Or if you choose to use Campus Cruiser, then you need to forward your WooMail. Whichever one you choose is perfectly fine. Those instructions are on this yellow paper that you're getting today. Yes, ma'am?
Can I ask, if we're also enrolled as a student here, then it would benefit us to forward it to which account?
If you are also enrolled as a student here, I would live inside of Campus Cruiser.
So we want to forward from Woo to Campus Cruiser?
Correct. So
Okay.
log into your WooMail and forward inside of that platform, and then that way you only ever have to go into Campus Cruiser.
And is the system smart enough that as we're coming on and we're brand new adjunct faculty members and we're also students, is there going to be 3 of us emails, or is it smart enough to know we already are in the email system?
That's a great question, and I had one person who was in that situation this past semester. The system wasn't smart enough for the first 2 weeks. But once we kind of let it level itself out, then finally that person only had her regular Campus Cruiser email and her regular WooMail. It just made a whole separate WooMail for her, but made all of it capitalized instead of lowercase. So, the case sensitive doesn't matter when you're sending email, so it was the same thing anyway. They just assigned her a whole other address with capital letters.
Do we then, as both a student and a faculty member, are we going to have 2 different Campus Cruisers, or when we log into one Campus Cruiser, are we going to have the 2 different functions in the class we're taking as a student versus the class where we're... You
will have both. Your classes will have your class as a student and also your classes that you're teaching.
Okay.
Up at the top, inside of your browser, here for WebAdvisor, you would have both your student links, which would be all your financial aid and anything else that might go through the student side, and then you would also have your faculty links, which would be your payroll and your W-2, so you would have access to both of those portals as both of those
we
things.
continue as one login?
Correct.
Okay.
One login.
Perfect.
One login. One login. Let's hope for that. Yes, ma'am?
And if we're new, when and how do we acquire a Drexel, and when does that happen with email?
I don't know, you'll have to ask Drexel.
I know.
You mean Winder?
Well, I know, I'm
Yeah,
sorry.
no. I knew exactly. I don't know how that works over there. When you're signed on through HR sends an email to the email address that you gave them when you started.
Gotcha.
So you gave them your Gmail address or your Yahoo address or whatever it is. You'll get an email from Winder saying this is your login, this is your password, and it's a generic password. It'll prompt you to change it as soon as you sign in the first time.
Thank you.
Absolutely. Okay. So again, everyone will get this wonderful yellow paper that will show you how to do this. Now, not only did I do, hopefully, an awesome job of putting this on the yellow paper, I'm going to show you where I also made this into a video. So if the paper is not the way for you to go, you can hear my lovely voice through a microphone showing you step by step on a computer screen how to do this. And I will show you where to find those as well. Okay? So we'll get both of those, and we'll do that at the end there. All right, let's see, what we got next? Okay, that's our forwarding. We'll look at that again. Some other things that are inside of Campus Cruiser here. Obviously, if you're using the gradebook, marvelous thing to do. If you want to keep those students aware, I know that if I was paying as much as probably the students are paying to come to this college, I would want to know what my grades are in an instant. Okay, so that's something to keep in mind. If you're more of a, I like to keep them myself, and that's the way we want to do it, that's fine. If you want to report them through email or use an Excel spreadsheet or something like that, that's fine too. Just make sure there's some sort of contact there. I mean, put yourself in the student's position. The amount of time and energy that is put forth into the classes that they are attending and not knowing what they have in that class up until maybe you decide to share it before that final or maybe before that midterm, that would drive me nuts. And I don't know, that's just me. So that grade book is a very good thing to use in there. You can even put the category weights in there. So say you have an assignment that's only worth 20%, you have something else that's worth 10%, you have attendance that's worth 30%, and all these other categories, and all of a sudden you got the calculator out, you're moving the decimal, you're multiplying by 3, you're moving it, oh my God, way too much. You can put it all in gradebook, it will calculate all of it for you. Okay, again, that's something that I have already made a video on, so if you would like to know how to do that, and that's something you want to dive into, you are welcome to view that video. You view the video, you still have no clue. Along with your yellow sheet today, you will also get my handy dandy business card. On my handy dandy business card is my email address and my phone number to my office. I have multiple platforms that I can talk across, whether that is me sharing my screen with you, talking over the web with you, or talking on the phone with you. I can talk you through mostly everything that you would need to use on Campus Cruiser and WooMail. So please, if these are things that you would want to try and things that you think will make your class better and easier and engage your students and provide the learning that we would like to give these students here at Widener University, give your instructional technologist a call and let me help you with that. I would love to. Okay? All right. On top of your grade book, you have your uploaded files. These would be the things that you want to share with the students, whether they're articles, different rubrics, different papers, things that you want to share with them. You can put those in uploaded files. It's kind of like a virtual jump drive. You know, instead of carrying that little stick around in your pocket, now all of that stuff is on Campus Cruiser. Okay, so those students can have access to all that stuff anyway, and not only is it on Campus Cruiser, it's also in WooMail too. So I'm going to show you where that is there as well. I don't think you really need to worry about adding and removing members. A lot of you, because you're adjunct faculty, you have a coordinator above you, and if someone needs to come into the class or be out of the class, that's the coordinator's responsibility. So if for some reason someone's missing, or there's someone in there that's not supposed to, get a hold of your coordinator and they should be able to take care of that for you. And last but not least, obviously the communication is a huge part. Now, I know that a lot of communication can be done within the course itself. Okay, all of these things can be put on a message board. This test is this day. This is when this is due. So all of that communication can happen. I was working with the maternity group last week, and Pam Williams, one of our marvelous professors here, said, you know, what if there's a snow day or something, how do you get a hold of the students? And I said, oh, well, I'm going to text them. Okay, that's a good idea. I think texting is a great feature to use. Do you have all the students' phone numbers? Well, I did have all the students' phone numbers, but the one student, she had a real tough day at the hospital. I know you guys have that all the time, and the phone got broken. So now she has a new number, but I forgot to update the phone number. So now that student is sitting in the parking lot waiting for class that you canceled, but because she had a phone number and you texted the wrong number, now that student doesn't know that class is canceled. Okay, so that communication piece is absolutely huge. And because we all have these wonderful things that are in our pockets, and for some of us are right in front of us literally 24/7, this is all mobile on the phone. So if the students are using their phone, they can access this information And even then, that might not be enough. So I know that there are millions and billions of tools out there that can make your life easier. This is the one that I'm going to show you today outside of Campus Cruiser that will allow for constant communication through your students 24/7. So why the hell would I want to talk to my students 24/7? Or you might not want to talk to them, but they might want to talk to you. Okay, maybe they need to send you a message. Maybe they're having an emergency. Maybe they're freaking out and they just need a reassuring voice that everything is going to be okay. Sometimes you need to be that voice. Okay? This is the one thing, again, outside of Campus Cruiser and WooMail, Widener has no piece of this, but this has got to be the absolutely best thing on the market. It's called Remind. Why? Because it reminds you. Very clever. It used to be called Remind 101. Kick the 101 off the end. Big Brother bought it. Now it is 150 times better, and they dropped the 101. What you do is you make a group. Your group is assigned a special phone number and message. So for instance, my phone number on this, it's something crazy. It's like 502, 50, whatever. So you enter the phone number into your phone, and then you type the message. I'm just at Bobal, at B-O-B-A-L. When that person types the phone number and message into their phone, they're now in my group. So anytime on my phone, I open up my Remind app, and I click on my class, I say, class is canceled today, be careful, the weather is hazardous. That message just went to every single person in my class. One time. Now maybe Susie had a paper to present that day. And she wants to know, well, I'm supposed to present, what am I supposed to do? Susie replies to that message. But here's the best part. Susie's not replying to your cell phone. Susie doesn't know your personal cell phone number. Susie's replying to Remind. So it goes through Remind. Now it's archived in Remind. Okay, so the conversations that are taking place are now in that third-party kind of establishment. Well, I told him I wasn't going to be there. I texted. Well, the text isn't on my phone. Oh, I have it here in my Remind. It gives you that extra piece of documentation, but it also allows you to stay in constant contact with those people in a large setting. Okay, text 7, 8, 10, 25 people at one time can be a lifesaver, especially when some of those decisions are very fast. You know, oh, well, it's not supposed to start icing until 3 o'clock. Class is at, 2:30. Oh, well, the wind shifted. It's coming early. We're not going to have class today. You have to make that call in however, 5 minutes. You don't have the time to sit there